I hope you all had a good, healthy, sumptuous lunch. And to start off the second part of the day, the session 4, we begin with the invocation song, and we have the Kridakul teachers here who are going to present the invocation song.
क्षितिजनवे रे क्षितिजनवे क्षितिजनवे रे क्षितिजनवे क्षितिजनवे मज सतत बोलवी साथीला सन्मित्र हवे आज एकटा अनघड जरी मी मनात अंकुर हा उगवे क्षितिजनवे रे क्षितिजनवे निद्रे मधुनी जागा होता नवाच मी मजला दिसतो उलगडणारी दुनिया भवती मी मध्ये माझा नसतो सागर झोपे मधली हसरी स्वप्न मालिका अवतरते कठोर अवघड सारे सरुनी आसमंत होती रवे आसमंत होती रवे क्षितिजनवे रे क्षितिजनवे सुटती सरशी सुटती घडिते गूढ समस्या आकळती शतकांमधल्या उग्र लढाया जिंकून आम्ही छत्रपती ग्रहगोलांची भ्रमणे अगतिक आणि नियती सर्वकडे अज्ञानाचा तिमिर सरे अनज्ञानाचा सविता उगवे ज्ञानाचा सविता उगवे क्षितिजनवे रे क्षितिजनवे मुसलेले दुरले गोळे आणि पांगले से रडवे मलाच माझे रूप उमगता चित्र मिळाले सर्व नवे मीन एकटा माझ्या सोबत विहंगमांचे भव्य धवे सर्वांसाठी एकच गाणे प्रबोधनाचे हे उजवे प्रबोधनाचे हे उजवे क्षितिजनवे रे क्षितिजनवे क्षितिजनवे रे क्षितिजनवे क्षितिजनवे रे सतत बोलवी साथीला सन्मित्र हवे आज एकटा अनघड जरी मी मनात अंकुर हा उगवे क्षितिजनवे रे क्षितिजनवे क्षितिजनवे रे क्षितिजनवे
I think beautiful voices and surely a bigger round of applause. I don't know where the energy is. I think post-lunch is always like this, right? Okay, maybe we can do something to wake you all up, get you all energized. So we'll have a small energizer. Okay, so requesting you all to stand up. Stand up. So I want the music ready. Yeah, can you hold it? Yeah, okay. So let's start this session with a bang, okay? Because I think it's a great mixture of sports and Ayurveda. And I can see mainly doctors. And I have on stage all the athletes here, the star athletes of Nyan Prabodhini. So we've been speaking your language mostly, I think. So let's see what they have to offer. We'll make them also do it. So I request, she's also my colleague, Avishri Rajput, to come in front. We're going to do a song, okay? And this song has a few actions, very simple, okay? There's nothing difficult about it. So I just want you to follow us. Is that clear? Very good. Good students. Okay. So the action goes like this and the song is like this. No specific meaning here, okay? Don't try to understand it. So it goes a rum zum zum. I want you to do it and also say it, okay? A rum zum zum. Come on, athletes, yaar, come on. Yeah, a rum zum zum. Manoj sir, aa jaiye. Sir, yes, yeah. Yeah, we can't miss out the boss, right? Okay, again, a rum zum zum. A rum zum zum. Guli guli guli. Rum zum zum. Okay, now I see three kinds of people here. Okay, one is people who are like, you know, and the second type is people who are like, okay, let me do this. And the third type of people I can see is, koi mujhe dekh to nahi raha. Okay, so that, I hope you are not that. Do it as if nobody is watching you, nobody is judging you, okay? Nobody is judging you. Okay, so let's do this. A rum zum zum. A rum zum zum. Guli guli guli. Rum zum zum. Okay, then we go like a sleeping baby. Don't go to sleep, okay? So you go a Rafik. Are baba bolo. A Rafik. A Rafik. Guli guli guli. Rum zum zum. Perfect, you're all pros. Okay, go home and teach this to your kids. Now, there's a catch here, okay? There's a catch here. This is your warm-up session. Are athletes khade hain in front of you. We'll play the music. And I will see how well you keep up with the beat of the music. Is that fine? You just follow us. Ready? Can we have the music?
3, 2, 1, Sabina, musica!
Okay, hands up. Let's make some noise, yaar. Come on. Woo! Okay, can you go faster than this? Come on, guys. Woo! Wonderful. A big round of applause. You all were wonderful, I think, and nobody missed a beat, okay? I didn't see, even if you did. I didn't see, not at all. Not at all. Okay. Yeah. So 2 warmed up. I'm sure you're charged. You know, the heart rate has gone up, the pulse beating fast, and I think in a happy way, in a good way, right? Wonderful. So the saying goes like this: hard work is a two-way street. You get back exactly what you put in. Where we are today was not easy to achieve. And this is the truth with all the star athletes that you see here, all the, prodigies of Nyan Prabodhani that you see here, of Krida Kul. And to introduce these prodigies, I call upon Dr. Asmita Itkarkar, Ayurvedchari, founder of Vedify Ayurved, and who also is a faculty of Minnesota Institute of Ayurveda, US. Okay, so calling upon Dr. Asmita Itkarkar.
I would invite Vaidya Amruta Deshmukh, who is an Ayurvedacharya and a certified nutritionist, PhD designate. She's going to interact along with her. She's going to interact with the national athletes, and along with her, we have Vaidya Dipti Dharmadhikari. She's in charge of Ayurveda. She's in charge Ayurveda physician at the Krida Cool. Please clap for all of them. They really deserve. They're doing hard work since past many years. Ma'am is also Ayurvedacharya, and we also have one more, Dr. Saugandh Deshmukh. Right? He is an ex-Krida Cool Kho player, so who better can interact with the players? They have their own brother within them. He is a PhD, he has done PhD in leadership qualities. Okay, so these are going to be some first-hand experiences right from the horse's mouth. We are going to listen what benefits they could acquire because of Ayurveda lifestyle, diet, and some implementations regarding sports injuries. So they are going to interact, and I would like them to take over the session after the felicitations. Okay. So I call upon Manoj Devekar sir for felicitating. Yeah, actually she's going to do the script.
So sir is like warmed up. He's already on stage, yeah, before me. Okay, great. So we are going to felicitate our moderators for this session. So I request Sir Manoj Devekar sir to kindly felicitate Dr. Amruta Deshmukh. Also felicitate Dr. Dipti Dharmadhikari. And Miss Asmita, Dr. Asmita Itkarkar too. You need to be, yeah. Okay. Thank you, sir. Thank you so much. We have our athletes here. So I request Dr. Anand Lunkad, sir, to come on stage. Yeah, so we are going to be felicitating all the athletes here. So, Mr. Santosh Gadge. Miss Neha Gaikwad. Yeah, so they will be, introduced.
experience. They will be sharing their first-hand experience. In Kridakul, we have been applying Ayurveda in their game selection process before their admission, before they get admission in Kridakul, and then secondly, in their lifestyle management training, where nutrition, ahar, vihar, aushad, we have been listening since yesterday, all these parameters, how we used to apply and how they used to take it all. And third and very important part is injury management and performance enhancement. So in all these areas, we have been applying Ayurvedic procedures, lifestyle management module, and assessment protocols for the all the students. So me and Dr. Sauganda, who is a friend of all, brother of all of them, and we will be conducting this interview. And Dr. Dipti Dharmadikari will also be one of the interviewee. So how we will be asking her end of experience, because she has been working with Kridakul since almost more than 14 years now. Yeah, I hand over to.
All of you must have seen them. They are very shy people. They perform at the highest level, but they can't talk in front of such crowd. So to make them comfortable, I will be conducting all the conversation in Marathi. And if needed, my colleague Dr. Amruta will translate or summarize those conversations in Hindi or English. Is it okay for all of you? Okay. खूप घाबरलेले होते हे सगळेजण आता स्टेजवरती बसून बोलायचं आहे म्हटल्यानंतर. संतोष म्हणाला मला मल्लखांब करायला सांगा, मी मल्लखांब करतो. नेमक्या आज त्याला ड्युटी असल्यामुळे त्याला यायला उशीर झाला, नाही तर तो कालपासून आपल्यामध्ये असता. पण त्यांच्याशी मी मराठीतनं बोलेल आणि गरज लागली तर आपण सगळे हे इंग्लिशमध्ये ट्रान्सलेट करू. पहिला प्रश्न, स्पोर्ट्समन किंवा स्पोर्ट्स प्लेयर याच्या आधीसुद्धा आपण सगळेजण क्रीडाकुलमध्ये होतो तेव्हापासून आपल्यावरती आयुर्वेदाचा एका अर्थाने मारा झाला असं म्हणायला हरकत नाही. आम्ही एक खेळाडू असायचो आणि एक 4-5 डॉक्टर्स आमच्याबरोबर कायम असायचे. ते या आयुर्वेदाचा मारा 5वीपासून होण्यापासून ते प्रत्यक्ष खेळायला लागल्यानंतर आपण सगळेजण जेव्हा आपल्या आपल्या लेवलला परफॉर्मन्स देत होतो त्यावेळेला या सगळ्या आयुर्वेदिक ट्रीटमेंट्सचा, आयुर्वेदिक प्रोसिजर्सचा आपल्या एकूण लाईफस्टाईलमध्ये काय उपयोग झाला, ॲज अ प्लेयर, ॲज अन इंडिव्हिज्युअल आपल्या सगळ्यांवरती काय परिणाम या सगळ्या लाईफस्टाईलचा झाला, अशाबद्दलचे काही एक्सपिरियन्सेस आपण ऐकूयात. सुरुवात भूषणनी करावी असं मी त्याला सुचवतो.
नमस्कार, मी भूषण कदम. पहिली रिॲक्शन तो हुश, त्याने मला मराठीत बोलायला सांगितलं. इयत्ता 5वीला आमचं ॲडमिशन झालं सर्वप्रथम, आणि त्याच्यानंतर आम्हाला खेळाचं फक्त आवड होती म्हणून आम्ही 5वी तिथे ॲडमिशन घेतलं. त्या मानसतज्ञ विभाग, आयुर्वेदिक विभाग वगैरे असे विभाग होते, पण त्याच्याबद्दल आम्हाला फार काही ज्ञान अजिबात नव्हतं. आणि सांगायचं आहे तो असं की जेव्हा ते पंचकर्म चालू झालं त्याच्यामध्ये नस्य, बस्ती, स्नेहस्वेदन 3 हे तर आम्हालाच होते. हां, स्नेहस्वेदन, मसाज म्हणजे स्नेहस्वेदन. तर पहिल्यांदा आम्हाला बस्ती दिली होती तेव्हा मी म्हणजे घाबरलो होतो. तेव्हा घरी जाऊन सांगितलं, आई त्यांनी आम्हाला इंजेक्शन टोचवलं आहे. ठीक आहे. तर त्याच्यानंतर खूप घाबरलो. त्याच्यानंतर मी जायलाच कंटाळा केला आणि मुलांना पण सांगितलं तुम्ही पण काय घेऊ नका, हे खूप डेंजर असतं. ठीक आहे. म्हणजे असे बरेच किस्से आहेत की आम्हाला त्याच्यात नॉलेजच नव्हतं फार. मग एक दिवस असं झालं की बरेच मुलं जात नव्हते. नस्येला टाळाटाळ करायचे, बस्तीला टाळाटाळ करायचे. मग 6वीला येताना डॉक्टर बोरकर मॅडम यांनी आम्हाला एक लेक्चर घेतलं आणि सांगितलं मुलांना जसं इंजिनला ऑइलची गरज असते किंवा पोटातलं ताकद वाढण्यासाठी ऑइलची गरज असते, त्यासाठी आपल्याला म्हणजे इंजिनला ऑइलची गरज असते तसं शरीराला पण चालवण्यासाठी ऑइलची गरज असते. तर त्यासाठी तुम्हाला हे घ्यावं लागेल आणि एवढंच सांगितलं. पण एवढं आम्ही डॉक्टरांचं मनावर नाही घेतलं. पण प्रशिक्षकांनी जेव्हा आम्हाला या गोष्टीचं बरंचसं नॉलेज दिलं, म्हणजे माझे प्रशिक्षक डॉक्टर प्राध्यापक आनंद लुंकड सर आहेत, त्यांनी पण आम्हाला बऱ्यापैकी या गोष्टीचं नॉलेज दिलं की हे महत्त्वाच्या गोष्टी आहेत. मग आम्ही थोडं गांभीर्याने सुरुवात केली या गोष्टी घ्यायची. आणि खरंच आहे म्हणजे जेव्हा डॉक्टरांकडे जायचो तेव्हा आपण शॉर्ट टर्म म्हणजे जेव्हा अंग दुखतं तेव्हा आपण पेन किलर घेतो, तो शॉर्ट टर्म रिझल्टच आम्हाला भेटायचा. पण जेव्हा आम्हाला कळलं की याचा लॉंग टर्मसाठी जो रिझल्ट आहे तो खूपच महत्त्वाचा आहे आणि तो जाणवत होता आम्हाला, एका वर्षातच जाणवायला लागला. कारण की आठवड्यातून 5 दिवस आम्हाला स्नेहस्वेदन बस्ती दिली जायची आणि आठवड्यातून 1 का 2 दिवस स्नेहस्वेदन असायचं आणि नस्य रोज असायचं. त्यामुळं जसं 5वीला मी रोज आजारी पडायचो, म्हणजे कारणं भरपूर होती. आणि जेव्हा 6वीपासून 10वीपर्यंत आम्हाला हे रेग्युलर होतं तेव्हा आम्हाला कारणं तयार करावी लागायची, आजारी पडत नाही आहे पण आम्ही मुद्दामून जाऊन झोपायचो त्या विभागात. की आम्हाला काहीतरी झालेलं आहे आणि बसा, कारण की ते पुड्यांमध्ये बांधून द्यायचे त्या गोष्टी, ते हिंगवाज टक वगैरे असायचे, त्यामुळे आवडायचं आम्हाला. आणि बस्तीमुळे कसं आलं, पोटातली ताकद आपोआप वाढायला चालू झाली होती. त्याच्यामुळे आम्हाला त्या खेळात बराचसा त्याचा बदल दिसला की या गोष्टी खूप महत्त्वाच्या आहेत. त्याच्यानंतर स्पर्धेपूर्वी आम्हाला स्नेहस्वेदन वगैरे दिलं जायचं आणि त्याच्यामुळं अंग हलकं होतं किंवा बॉडीचे म्हणजे आमचे ज्या हालचाली होत्या त्या जास्त वेगवान व्हायच्या. आणि हे बाकी इतर आत्ता हे प्रोटीन वगैरे आलेले, तेव्हा खरंच अजिबातच काय प्रोटीन वगैरे नव्हतं, कारण की आम्हाला आयुर्वेदिकचा जो आहार दिला जायचा, ते दुधातून काय द्यायचं आपल्याला, भल्यकल्प दुधातून द्यायचे आम्हाला. तर हां, तर त्याच्यामुळं ताकदसुद्धा वाढायची. त्याच्यानंतर रात्री झोपताना क्वांटिटी सांगत नाही, पण बऱ्यापैकी द्राक्षसव द्यायचे आम्हाला आणि त्याने झोप चांगली लागायची आणि ते खूप आवडायचं की झोप शांत लागते. आता म्हणजे कसं होतं की संध्याकाळी आपण प्रॅक्टिसवरून येतो, मोबाईल घेतो, झोपच लागत नाही. पण जेव्हा द्राक्षसव घ्यायचो जेव्हा शाळेमध्ये, तेव्हा पटकन झोप लागायची आणि सकाळी पण ताजंतवानं होऊन आम्ही सराव करायचो. तर या बऱ्याचशा गोष्टी होत्या. किंवा आहारामध्ये आम्हाला लोणी वगैरे खायला द्यायचे. म्हणजे आहारसुद्धा आयुर्वेदिक असल्यामुळं आम्हाला बराच त्याचा प्रकार म्हणजे एक अनुभव चांगला आला. अजून दुसरी गोष्ट सांगायची म्हटलं तर जेव्हा मी बाहेर पडलो, म्हणजे 10वी नंतरसुद्धा बाहेर पडलो, ते मी म्हणजे आपलीच माझे विद्यार्थी आहे डॉक्टर प्रतिमा कोकटे, यांच्याकडे मी अजूनसुद्धा ते फॉलो करतो आयुर्वेदिक ट्रीटमेंट. म्हणजे मी टचवूड की मी आजारीच पडत नाही. म्हणजे आत्ता बरेच लोकांचं मी बघतो की बरेच लोक आजारी पडतात, काय सर्दी होते किंवा ताप आला लगेच, पण ते जाऊ शकत नाही. पण आम्ही 2 दिवसाच्या वर जरी सर्दी झाली, ट्रीटमेंटमुळे आम्ही लगेच ग्राउंडवर उभे असतो. तर हा आयुर्वेदिकचा माझ्या जीवनात झालेला मोठा बदल आहे. मी काही गोष्टी नंतर पण तुम्हाला शेवटी सांगेल, काय ड्रॉबॅक पण काय आहेत. म्हणजे मला जे जाणवतं ते ड्रॉबॅक असे नाही आहेत, पण मला काही जाणवतं गोष्टी ते मी वैद्यांना शेअर करेल. याच्यावर काय आपल्याला बोलता आलं तर नक्की तुम्ही सुचवा आम्हाला काय असेल ते. धन्यवाद.
Thank you, Bhushan. Bhushan has summarized what therapies he used to he was undergoing while he was in Kridakul. That included Basti, Nasya, Ayurvedic Ahar regime, and Drakshasav. He mentioned about it and how their view about taking those treatments and how it helped. How overall the effects helped to change his view toward taking treatment. So my next question is about the game selection. So every player, they have their some ideas about what they want to play, in which game they want to play. So according to yesterday we had session with Dr. Dipti and Dr. Medha, game selection criterias in Kridakul. So we have here Shreya and Piyush. So I would like to ask them about how Ayurvedic game selection plan or game selection process helped them in selecting their games and in their success. Shreya?
मी 5th स्टँडर्डमध्ये जसं सगळे टेस्ट वगैरे झाल्या मी त्याच्यामध्ये पास झाले. त्याच्यानंतर मला कबड्डी गेममध्ये जास्त आवड होती, पण माझे ओव्हर नीज लॉक्ड असल्यामुळे मला तो गेम करता आला नाही. त्याच्यानंतर मी योगा हा गेम चूज केला होता, ज्याच्यामध्ये मी अजूनही करिअर करते आहे. सुदैवाने सगळ्या गोष्टी शाळेतनं ज्या योग्य वयात मिळायला हव्या होत्या ते सगळं शाळेतनं मिळाल्यामुळे त्याचं आजपर्यंत पण परफॉर्मन्समध्ये फरक कळतो की आपल्यासोबत असणाऱ्या प्लेयर्सचा स्टॅमिना आणि बाकी माझा स्टॅमिना. मी 2 टाईम प्रॅक्टिस करते, सकाळी आणि संध्याकाळी, तरी पण मला रात्री असं जाणवत नाही की आपण फार थकलो आहे किंवा आपण उद्या प्रॅक्टिस करू शकत नाही. किंवा योगामध्ये इव्हेंट जास्त असल्यामुळे 4-4 दिवस परफॉर्मन्स करावा लागतो. मग होणाऱ्या इंजुरीज की 2 इव्हेंट खेळलेत, मग बाकीचे प्लेयर्स सांगतात की आता 3ऱ्या इव्हेंटसाठी माझ्यात ताकद नाही आहे किंवा मी खेळू शकत नाही, मी माझा 100% परफॉर्मन्स देऊ शकत नाही. तर माझ्या मते सगळी हेल्प, बस्ती, मसाज ह्या सगळ्याची मला त्याच्यामध्ये हेल्प झाली. त्याच्यानंतर स्टॅमिनाचं वर्कआउट घ्यायचे. मानसतज्ञांची जास्त हेल्प झाली कॉन्सन्ट्रेशन वाढवण्यासाठी, कारण की योगा हा कॉन्सन्ट्रेशनचा गेम आहे. त्याच्यामुळे त्याच्याबरोबर मानसतज्ञांची सुद्धा मला फार हेल्प झालेली आहे गेममध्ये. आणि बाकी रुटीनमध्ये मी अजून पण ॲज अ प्लेयर म्हणून परफॉर्मन्स करते. त्याच्यामुळे माझं आठवड्यातनं डेली मसाज एकदा वगैरे हे सगळं चालू असल्यामुळे माझा आहे तो परफॉर्मन्स अजून डे बाय डे ग्रो पण होतो आहे आणि जो जुना आहे तो लोकांचा हळूहळू ग्राफ खाली येतो एज जसं वाढतं तसं. पण सुदैवाने माझा परफॉर्मन्स वरती अजून चालत चाललेला आहे आणि मला असं वाटतं की दिलेला डायट आणि ते योग्य वयात काय खायचं ह्याच्यापेक्षा काय खाऊ नये हे कळाल्यामुळे आजपर्यंत अजून इथून ते इथपर्यंतचा प्रवास झालेला आहे. आणि माझ्या मते माझे सगळे टीचर्स आहेत की ते मला इथे बघत होते, ते मला सांगत होते की हां तुझ्यात आहे कॅलिबर, तू हे करू शकते. आणि त्यांच्या ज्या शाबासकीमुळे ती मी आज इथे बसलेली आहे. आणि माझ्यावर सगळ्यात जास्त कष्ट घेणारे पांगारे सर, जे की मला नेहमी सांगतात की हे खाऊ नकोस, हे तुझ्यासाठी हानिकारक आहे, किंवा मी तुला सांगतोय ना की डाएट काय असतं किंवा काय. मग त्या गोष्टी सगळ्या शाळेतनं मिळाल्यामुळे मी आज इथे आहे. थँक्यू.
थँक्यू
श्रेया ही आपल्याकडची अशी केस की ज्याच्याबद्दल काल आपण थेरॉटिकल डिस्कशन हे खूप जास्त प्रमाणामध्ये केले होते की प्रकृती असते का, मग खेळाडूचं सिलेक्शन क्रायटेरिया काही असतो का आणि त्याचं खरंच काही इम्प्लिमेंटेशन करता येतं का. किंवा आपण एक पेपर असाही काल बघितला, एक डिस्कशन आपण असंही बघितलं की गेम सिलेक्शन आणि प्रकृती याचं कोरिलेशन काय असेल. तर याचं उदाहरण म्हणून आज श्रेयाची केस आपल्या सगळ्यांच्या समोर आहे. श्रेया आली तेव्हा श्रेयाला खूप कबड्डी आवडत होती आणि श्रेया कबड्डी छान खेळतसुद्धा होती. पण श्रेयाच्या कडे आम्हाला नंतर असं जाणवलं की श्रेयाची नॉक नीज आहेत आणि आता नॉक नीजनी जर का श्रेया कबड्डी खेळत राहिली तर ती फार काळ खेळू शकणार नाही आहे. तिला पुढे पुढे इंजुरीज या वाढत जाणार आहेत. त्यावेळेला श्रेयाला समजवणं, श्रेयाला तिथून कबड्डीमधून योगामध्ये शिफ्ट करणं, पण तिने ऐकलं. शहाणी मुलगी होती आणि आहे, त्याच्यामुळे श्रेयानी ऐकलं. त्याच्यामुळे काल जे आपण सगळं बघितलं होतं की खरंच ह्या गोष्टींचा अनुभव येतो का, तर हो येतो. ह्याचं एक उदाहरण म्हणून आज श्रेया आपल्यासमोर योगासनाचे खूप वेगवेगळी पदकं घेऊन आज आपल्यासमोर श्रेया आलेली आहे.
I would like to ask the same question to Piyush. How game selection helped you in your overall career?
गेम सिलेक्शन करताना सर्वात आपले जे 2 गेम सिलेक्शन दिलेत त्याच्यामध्ये दोन्ही गेम असे रिलेटेबल्स होते. मला ॲथलेटिक्स आणि खो खो असे 2 गेम दिले होते, सकाळी ॲथलेटिक्स आणि संध्याकाळी खो खो. तर त्याच्यामध्ये गेम दिल्यानंतर काही काळानंतर मला काही इंजुरीज व्हायला लागल्या, जसं की हिल पेन, शिन पेन, अँकल इंजुरीज, नीच्या इंजुरीज. आणि त्याच्यावर ट्रीटमेंट करताना असं आढळलं गेलं की मला फ्लॅट फूट आहे. आणि त्या फ्लॅट फूटवर मला असं सजेशन दिलं गेलं, एक पहिलं म्हणजे खडतर ट्रीटमेंट, त्याच्यावर असणारी ट्रीटमेंट, आणि दुसरं म्हणजे गेम न खेळणं. तर त्याच्यातनं मी ट्रीटमेंट करणं हा उपचार म्हणजे हा ऑप्शन पहिले निवडला. आणि जर त्याच्यातनं काही झालं नाही तर मग न खेळणं हाच एक ऑप्शन माझ्याकडे राहत होता. तर उपचार घेताना सर्वात पहिले फूटप्रिंट घेणं, त्याच्यानंतर वॉकिंग स्टाईल, रनिंग स्टाईल याचं इव्हॅल्युएशन करण्यात आलं. त्याच्यानंतर मला स्वतःला खो खो हा खेळ आपण विदाऊट शूज खेळतो, तर मला सांगितलं गेलं होतं की शूज घालूनच खेळायचं आहे आणि त्याच्यामध्ये इन्सोल असलाच पाहिजे, ज्याला आपण कर्व इन्सोल म्हणतो. तो कर्व इन्सोल मी त्याच्यात इन्स्टॉल करून घेतला होता माझ्या शूजमध्ये, जेणेकरून मला ते फ्लॅट फूटवर एक ओव्हरकम करता आलं आणि मला चांगला खेळ खेळता आला. आणि त्याच्यावर मी ओव्हरकम एवढं चांगलं केलं की मी त्याच वर्षी नॅशनल खेळलो आणि आत्तासुद्धा त्याच क्षेत्रामध्ये खेळत आहे. आणि नुसता खेळत नाही आहे तर मी आत्ता 2 क्लबमध्ये ॲज अ कोच म्हणून काम पण करतो. आणि अशा काही इंजुरीज मला जर मुलांमध्ये काही आढळल्या तर त्यांना मी त्या पद्धतीचे सल्ले पण देतो, और डिरेक्टली मी वैद्यांकडे पाठवून त्यांची ट्रीटमेंट करण्यास सांगतो. धन्यवाद.
पियुषची बॅच ही खो खो प्रेमी बॅच अशी ती सगळी बॅच होती. त्या बॅचमधले असे खूप छान खो खोची टीम होती. आणि जसं आत्ता पियुषने सांगितलं फ्लॅट फूट आहे आणि फ्लॅट फूटला एवढं सगळं केल्यानंतरसुद्धा मॅचेसच्या आधीची प्रॅक्टिस असेल किंवा मॅचेस झाल्यानंतर त्याला स्पेसिफिक ती हीलला पेन ही असायचीच. आणि आज प्रॅक्टिस खूप झाली आहे, आता हे दुखतं आहे आणि आता उद्या परत मॅच खेळायची आहे. तर मला पियुषच्या टीममधले असे खूप मुलं आठवतात की जे असे ओळीने आलेले असायचे की ताई आता चटका दे. अग्निकर्म ही कन्सेप्ट फारशी मुलांना नावानिशी माहिती नसायची, पण आज चटका घेतला तर उद्या दुखणं थांबणार आहे आणि मी पळणार आहे, हा अनुभव यांच्या बॅचनी खूप जास्त घेतला होता. त्याच्यामुळे अग्निकर्मासाठी खो खोची टीम अशी बाकीच्या सगळ्या प्रोसिजर्स असू देत, पण आधी चटका दे, दुखणं थांबू देत, मग आम्ही उद्याची मॅच खेळून येतो, हे सांगणारी ही टीम होती आमची. त्याच्यामुळे पियुषची बॅच खो खो आणि अग्निकर्म हे एक छान कॉम्बिनेशन असं सगळं तयार झालेलं होतं. चटका टीम असं म्हटलं तरी चालेल.
Going deep into injury management, injuries are part and parcel of every athlete's life. You cannot avoid injuries. तर इंजुरी मॅनेजमेंट आयुर्वेदाच्या माध्यमातून कसं केलं गेलं याच्याबद्दल सुरुवातीला संतोष, मग आरती आणि मग शुभम यांनी बोलावं असं सुचवेन. संतोषला आम्ही चिडवतो की त्याने खूप जळवा मारल्यात आत्तापर्यंत असं. तर एकूण हे सगळं कसं गेलं असं?
सगळ्यांनी तर सगळं सांगितलं आता. जास्त करून मला त्रास व्हायचा. मी आरोग्य खात्यामध्ये जायचो, मी भरपूर जायचो, रोजच जायचो. म्हणजे थोडं बोलायला मी घाबरतो, हे सगळ्यांनी समजून घ्या पहिलं. पहिला असा विषय आहे की मला गुडघ्याचा भरपूर त्रास व्हायचा. माझा गुडघा इतका त्रास व्हायचा ना की म्हणजे मांड्यांचं वजन वाढल्यामुळं माझ्या गुडघ्यांना अक्षरशः वाकवताच येत नव्हतं, एवढा त्रास होता. 6 महिने तो त्रास झाला. शेवटी आयुर्वेदाने बऱ्याच गोष्टी केल्या. त्याच्यानंतर पोटरीला मला धुळ्याला मी कॉम्पिटिशन खेळायला गेलो होतो, त्यावेळेस मला बेंड आलं होतं इथं पोटरीच्या इथे. ते एवढं वाढलं होतं की त्या अख्ख्या पोटरीला पू झाला होता, पूर्ण डबल पोटरी अशी फुगली होती. 4-4 दिवसानंतर ना त्याच्यावर जळू सोडून ना ते रक्त पूर्ण ते पिऊन घेत होते आणि त्याच्यानंतर ते पूर्ण केलं. बाकी सगळ्यात ताई सांगेल.
संतोष ही लिगामेंट टिअरची केस, नी जॉईंटचा ग्रेड 1 लिगामेंट टिअर असलेली संतोषची केस. आणि जसं म्हटलं तसं की संतोष आणि मल्लखांब हे असं खूप छान बॉन्डिंग दोघांचं, की मल्लखांब आहे म्हटल्यानंतर संतोष करणारच असं. इतकं की कालच्या डेमोमध्ये सगळ्या स्टाफला पण संतोषची आठवण यावी इतका संतोष आणि मल्लखांब असं समीकरण आमच्याकडचं. आणि असं असताना आता त्या लिगामेंट इंजुरीमुळे असणारं प्रचंड दुखणं, खेळता येईल की नाही असं, मग ताई आता याचं ऑपरेशन करायचं का, आता काय करायचं, इथपर्यंत गेलेल्या त्या सगळ्या चर्चा, त्या MRIचे सगळे रिपोर्ट्स, असं सगळं असताना संतोषला आयुर्वेदिक ट्रीटमेंट सुरू होती, आपल्या विभागातच चालू होती. आणि त्यावेळेला टप्प्याटप्प्याने संतोषसाठी मग पिंडस्वेद असेल, तेलधारा असेल, तेलपट्टी असेल, ह्या सगळ्यांचा वापर संतोषवरती खूप जास्त प्रमाणामध्ये झाला. संतोषचा गुडघा टप्प्याटप्प्याने बरा होत संतोष परत मल्लखांब खेळायला लागला आणि तो आला, ॲक्शनमध्ये आला. आणि माझ्या मते त्याच्यानंतर त्यांनी युनिव्हर्सिटीमधले मेडल्स घेतलेले आहेत. म्हणजे त्या इंजुरीनंतर संतोष बरा झाला आणि मग पुढचा संतोषचा प्रवास हा युनिव्हर्सिटीमधल्या मेडल्स आहे. आता त्यांनी सांगितलं तसं ती ॲप्सेस तयार होण्याची जी टेंडन्सी होती ती त्याच्यामध्ये झाली होती. म्हणजे थोडं पित्ताचं आधिक्य असं सगळं असल्यामुळे साधारणतः संतोषला ॲप्सेस येणं ही एक खूप कॉमन गोष्ट होती. आणि आता जसं मी खो खोच्या टीमचं चटक्यांच्या बाबतीत सांगितलं तसं तो येऊन मला सजेस्ट करायचा, जळू लावायची आहे का, इतकं ते त्याला माहिती झालं होतं. म्हणजे एकदा त्यांनी तो अनुभव घेतला की ह्यांनी लवकर बरं होतं आहे आणि पटकन आपण याच्यातून बाहेर पडतो आहोत. त्याच्यानंतर संतोषच्या बाबतीमध्ये जळू लावणं हे खूप कॉमन झालं होतं. म्हणजे अगदी सगळ्या शाळेला माहिती होतं. संतोषला जळू लावल्यानंतर इतर लहान मुलं बघायला वगैरे यायची, जी खास करून मल्लखांब खेळायची, ती मुलं तर येऊन बघून जायची की काय केलं आहेस, कशी लावली आहे जळू वगैरे. म्हणजे संतोषला जळू लावणं हा एक शाळेसाठी तेव्हा एक अट्रॅक्शनचाच कार्यक्रम आमच्यासाठी होऊन जायचा, की ती मुलं परत पाठवून दमायचो. संतोषच्या जळवांचे किस्से हे खूप गाजलेले होते त्या काळामध्ये, सगळे त्याला चिडवायचे पण खूप. त्याच्याच जोडीला संतोषच्या मल्लखांबच्या ह्याच्यामध्ये आयुर्वेदानी खूप कस्टमाइज काम हे नक्की संतोषच्या बाबतीमध्ये झालं. एका ठराविक टप्प्यामध्ये आल्यानंतर वजन वाढणं, फ्लेक्झिबिलिटी कमी होणं, ह्या गोष्टी संतोषच्या बाबतीमध्ये जरा जास्त प्रमाणामध्ये दिसायला लागल्या होत्या. तेव्हा संतोष कॉलेज गोईंग होता आणि मग तेव्हा ते वजन वाढतं आहे आणि आता आधी इतका मी फ्लेक्झिबल नाही आहे, हे मला नाही करता येते, अशी सगळी संतोषची ती सुरुवात होती. त्यावेळेला संतोषवरती आपण विरेचनाचाही प्रयोग केला होता. विरेचनानंतर संतोषची फ्लेक्झिबिलिटी वाढली, हेही झालं होतं. आणि याच्याच जोडीला जसे जसे मुलं पुढच्या लेव्हलला गेले तसे पुढच्या लेव्हलसाठी मग असणारे पिंडस्वेद असतील. आपण मल्लखांबच्या मुलांसाठी पिंडस्वेदाचा एक पॅटर्नच तयार केला होता की पाठीच्या मसल्सची स्ट्रेंथही वाढली पाहिजे आणि याच्यासाठी पिंडस्वेद हे मुलांचे झाले पाहिजे. तर याच्यासाठी पिंडस्वेदाचंही संतोषवरती खूप जास्त प्रमाणामध्ये इम्प्लिमेंटेशन झालेलं आहे. संतोष हा मला असं वाटतं की आत्ता स्टेजवर बसलेल्यांमध्ये सगळ्यात जास्त प्रोसिजर्सचा लाभार्थी वगैरे म्हणून डिक्लेअर करायला काहीच हरकत नाही आपल्याला.
शुभम, आरती.
फर्स्ट ऑफ ऑल कबड्डी म्हणजे इंजुरीज. कारण इंजुरी असं सगळ्यांना वाटतं पण तसं नाही आहे. जर तुम्ही स्वतःमध्ये स्ट्रेंथ ठेवली तर इंजुरी कमी होईल. कबड्डी म्हणलं की शोल्डर, नी, अँकल जास्त करून इंजुरी आली. मी सांगेल ताईचं, कारण मला बालेवाडीला टुर्नामेंट होती. मला अँकल माझा थोडासा ट्विस्ट झाला होता आणि त्याच्यानंतर 4 दिवसांनी ऑल इंडियाची टुर्नामेंट होती, युनिव्हर्सिटी सिलेक्शन होतं. ट्विस्ट झाल्यानंतर 4 दिवसांनी आता काय करायचं. त्याच्यानंतर मी ताईकडे गेले. ताईने मला लेप सांगितला की हा तू 4 दिवस कंटिन्यू हा लेप कर. तू बजरंग लेप होता तो. मी 4 दिवस कंटिन्यू तो लेप केला. त्याच्यानंतर 4 दिवसांनी मी माझी टुर्नामेंट होती इंदापूरला, युनिव्हर्सिटी सिलेक्शन. त्याच्यानंतर मी एकदम 4 दिवसांनी एकदम उभी पण राहू शकले आणि मी खेळू पण शकले. माझं सिलेक्शन पण झालं आणि प्लस मला बेस्ट प्लेअरसुद्धा भेटलं तिथे. आणि कबड्डीच्या कोणत्याही स्पर्धा आल्या की फर्स्ट ऑफ ऑल सगळी वजनावरती असायच्या मुली. सगळ्यांची 2-3 किलो 4-5 किलो ही सगळ्या मुली जास्तच असायच्या. त्याच्यानंतर महिनाभर अगोदरच ताई आम्हाला पूर्ण डाईट प्लॅन लिहून द्यायची की पालेभाज्या खा, कडधान्य खा, हे खाऊ नका, ह्यानी वजन वाढलं जाईल, ह्या गोष्टी तुम्ही करा, मग त्याने तुमची वजनं वाढणार नाहीत. आणि सगळ्याच मुली की ताई हे नको का खायला, ते नको का खायला. आणि आम्ही आता प्रॅक्टिस पण करणार आहे, आमचे मॅचेस पण जवळ आले आहेत आणि आमची एवढी स्ट्रेंथ जाते, त्याच्यामुळं आम्हाला थोडी ताकद पण पाहिजे ना की आम्ही वजन कमी करतो आहे. त्यानुसार ताईचा डाईट एकदम करेक्ट 1-2 महिन्या अगोदरच ताई पूर्ण डाईट प्लॅन व्यवस्थित लिहून द्यायची की जेणेकरून काही म्हणजे मॅचेसला वजन तर आमचं सगळ्यांचं आत्तापर्यंत कधीच असं झालं नाही की कबड्डीच्या कोणत्या मुलीचं वजन मॅचेसला बसलं नाही. सगळ्यांची वजनं एकदम कम्फर्टेबल बसायची पण आणि सगळ्यांचा परफॉर्मन्स पण चांगला असायचा. कारण डाईट असा असायचा की वजन तर कमी होणारच पण शिवाय आपला परफॉर्मन्स पण कमी नाही झाला पाहिजे. आणि आम्ही बाहेर जायचो तेव्हा सोलापूर वगैरे ह्या साईडच्या मुली बघायचो ना, तेव्हा असं वाटायचं की आपल्याला ह्या ज्या शाळेतच ट्रीटमेंट भेटतात आहे. म्हणजे की मसाज आमचा एक 3-4 दिवस अगोदर मसाज असायचा की जेणेकरून आम्ही पूर्ण बॉडी रिलॅक्सेशन झालं पाहिजे आमचं. आणि मला नसत्याचा पण खूप फायदा व्हायचा कारण मला पहिली खूप सर्दी व्हायची. थंडीत तर मी सर्दी म्हणजे जास्त व्हायचीच मला, त्याच्यामुळे नसत्याने मला खूप फरक पडला. आणि बस्ती म्हणायला गेलं तर बस्तीने पोटाची ताकद खूपच वाढायची कारण कबड्डी खेळताना पोटाची ताकद ऑलमोस्ट लागतीच जास्त. त्याच्यामुळे ह्या सगळ्या गोष्टींचा आम्हाला फायदा व्हायचा. आणि बाहेर गेले की असं कळायचं की यार आम्हाला ह्या शाळेतच म्हणजे आता ह्या गोष्टी आता सगळ्या आपण खेळायला स्टार्टच केले तर ह्या गोष्टी आम्हाला माहीत आहे आणि बाहेर अजून ह्या गोष्टी कुणाला माहितीसुद्धा नाही. आणि बाहेर ह्या आपल्याला शाळेतच मिळायच्या. बाहेर आता आपण मसाज करायला गेलं की 1000-1500 रुपये स्टार्टच आहे आणि नसते बस्तीचे तर विचारायलाच नको रेट. त्याच्यामुळे ह्या शाळेत असतानाच ह्या गोष्टी भेटायच्या पण तेव्हा कळत नव्हतं. जेव्हा बाहेरील प्लेयर वगैरे बघायचो तेव्हा असं कळायचं की यार आपल्याला हे भेटत होतं शाळेत आणि आता किती महाग आहे ह्या सगळ्या गोष्टी. त्याच्यामुळे शाळेत खूप सगळं फायदा झाला. थँक्यू.
I think we are experiencing a nice mixture of technical terms, terminologies, along with their emotions also. कसा याचा सगळ्याचा उपयोग होतो आणि आता याचं महत्त्व कसं कळतं आहे असं. आपण मल्लखांबाकडून कबड्डीकडे आलो, आता जिम्नॅस्टिक्सकडे जाऊयात. शुभम.
नमस्कार. सुरुवातीच्या वेळामध्ये प्रॅक्टिस करताना 1-2च अशा बऱ्यापैकी इंजुरी झाल्या होत्या मला. त्याच्यामध्ये सिंगल बार सगळ्यांना बघून तरी माहिती असेल. बारची हाईट साधारण 10 फुटापर्यंत असते. त्याच्यावर सर्कल करत असताना माझा हात सुटला आणि तिथून वरती अजून 3-4 फूट जाऊन मी खाली असं 12 फुटापर्यंत येऊन जमिनीवर पडलो होतो. त्यावेळेस राईट साईडला असं पडल्यामुळे तो जॉईंट पूर्ण माझा इतका दुखायला लागला होता की माझा गुडघा आपल्या कमरेच्या लेवलच्या वरती येत नव्हता. एक साधारण त्याच्यावर मसाजची ट्रीटमेंट डॉक्टरांनी चालू केली. त्याच्यामध्ये 3ऱ्या-4थ्या दिवसानंतर मला प्रॉपर ती पाय उचलणे किंवा एक प्रॉपर रनिंग करणे ही एक हे व्हायला लागले, म्हणजे जमायला लागलं. मसाजनंतर स्टीम पण ती कंटिन्यू होतो. मसल एवढा चांगला रिलॅक्स झाला माझा. एक साधारण 10व्या किंवा 12व्या दिवशी मी परत रेग्युलर प्रॅक्टिस चालू पण केली होती. आणि दुसरी रिस्ट इंजुरी अशी झाली होती, जरा जास्त ओव्हरवेट आलं होतं. जिम्नॅस्टिक्समध्ये पूर्ण मॅक्सिमम आपला भार दोन्ही हातांवरच असतो. त्यावेळेस ते एका रिस्टवर जास्त प्रेशर आल्यामुळे ते सुजणं वगैरे तो प्रकार चालू झाला. मी कंटिन्यू बँडेज घालून प्रॅक्टिस करायला लागलो. पण ते एक शॉर्ट टर्म हे होतं, बँडेज लावून करणं किती वेळ करणार. त्याच्यामुळे मग डॉक्टरांनी ताईने सांगितलं तसं ते अग्निकर्म, मला नाव पण आता आठवत नव्हतं, आणि ते चटके देण्याचं हे एक चालू झालं की तिथे जायचं. पंचधातूची एक हे होती, त्याच्यामध्ये ते चटके दिल्यानंतर ते संध्याकाळच्या सेशनमध्येच एवढं रिलीफ असायचं की यार हाताची मुवमेंट पूर्ण होती, विदाऊट बँडेज प्रॅक्टिस करू शकतो आहे. मग ते कंटिन्यू 2-2, 3-3 दिवसाच्या अशा गॅपमध्ये ती ट्रीटमेंट चालू होती आणि बऱ्यापैकी मला म्हणजे अजून पण ते जॉईंट्सचा तो पेन पूर्ण संपलेला आहे. त्याच्यानंतर रिस्ट आधीमध्ये थोडीशी थंडीची दुखते, पण प्रॅक्टिसमध्ये त्यावेळेस पूर्ण बंद होते. असा बऱ्यापैकी मला चांगला अनुभव आला होता.
Thank you. We got their experiences on Ayurvedic treatments like Basti, Agni Karma, then Jalokavacharan, bloodletting, and Ahar regime. How it helped them in their performance and overall their lifestyle. Neha is the first batch student of Kridakul, and she is with us, and we are with us. We all are. Together we are moving forward. So I want Neha to emphasize on her journey and describe her journey with Kridakul and how Ayurveda is helping her in her career.
Thank you, Amrita Tai. I need to stand up and walk because my heart rate is too high. I can't sit and talk with you because, as he said rightly, Saugan, that player is always excellent on floor, on the ground. But whenever we come in front of the mic, it's too difficult for us. But still, I need to try to explain my journey. As Amrita Tai said, yes, I was the first batch in the Kridakul. And that time, I just want to share my experience. Like, Devekar sir is there, Sonone sir is there, and they are conducting, for the part, like fitness test. Whenever you want to enter into the Kridakul, we need to go through some process. And that time, I was in the 5th standard, and my weight is hardly 15 or 20 kg. So what is our target? Like they are saying the throwing ball in our hand, and I need to push that ball in some meter. How I can? Because I am like a sukki kadi, and I can't. So in each and every, I think I was only excellent in for flexibility test. I was very good on that because I think by born I am a little bit of flexible. Then all the examples, all the whatever they are giving me, the targets, I am not able to, cross that targets. Then they said she is not able to part in that Kridakul process because she is not fit. Yeah, I was not fit, but my mom, she always told me or always told him also, ki, please sir, try once, just enter her into the Kridakul, then we'll see what she can do it. They said, okay, we'll give you one chance. In the 5th standard, I and one of my friends, we two are there. And in the 5th standard, I'm trying to cope up with all the activities, but I can't. It's highly impossible because I have that child asthma, some of the allergies and a lot of stomach issues. So that's really difficult for me to cope up all that things. In the 6th standard, whenever I enter to the 6th standard, then that is my first, the Ayurvedic, Dr. Milin. So he is there. So sir, Dr. Milin, Sonane sir, all are there, and they conduct a meeting, and they want, if she wants to improve her performance, she has to go this path. Whatever they are saying, the Nasya, Basti, and all that things. Now there is a one catch. First, I was entered into the Kabaddi, and I was played very well Kabaddi player. So I have into the Kabaddi team in the right corner. And whenever we used to, go to the competition, everyone said, you have to go there. She can't hold your chaudak. That is too difficult for because she is so thin. Okay, the first, the 6 months, I always used to hold that, and they are dragging me to the end line. And my elbow, my knees, everything is, the blood here and there. But, after some months, whatever they are giving me the process, I'm a little bit of stronger, my, whatever we can say, that the allergies and the asthma, everything is slowly going down. I'm a very good Kabaddi player also. Then I'm become a good, stronger girl. Then Devekar sir said, no, she is good in high jump. So I used to do high jump also. But in high jump, I have a very good flexibility, but I don't have a leg strength. So what can we do? And you know that the high jumps, we need a thin person. We don't want to get a fat in your thighs and hips and everything. Then they said she had a little bit of fats. So again, Dr. Milin sir, he's again giving me some diet. For me, in the Kridakul, we was that a process on that time. They are selecting 10 students as little bit of excellence level, and they are giving to each doctor, they are saying, this is your target. You have to do some work on that particular athlete. So he is always giving me that massage. If I have a little bit pinch of the fat on my thighs, then the oil with, I think there is some powder, I don't know what you can say. So they are always rubbing that to, to strengthen your muscles and to reduce that fat. But again, my strength is there, my fat is there, everything is there, but still the abdominal and core strength is not there. Then again, using some Ayurvedic medicines and the basti is there. So after this, so 2000 till 2005, in last 5 to 6 years, they are doing that the procedures and everything. Then I was good into the high jump also, as well as parallelly I was going with the yoga and rope mallakhamb. Now you can analyze, the first time they said she can't do anything, but through the Ayurveda, she will do it more than 5 games in a national level. And I was the one person is here to say, yes, Ayurveda is good for me also, because, after my career, when I stop my career and I can see, whatever I'm going to the Punjab for the next 5 years, and there I don't have that process, because that time I was selected for the 2012 Olympic camp, and for them till morning 6 to night 10, I have on the floor to do that practice. Now I'm there on the another state, my coaches and my doctor is here. Still each time whenever I'm coming here, I used to come here, I do that, all the massage and all that things, and then again I have to go there. How is it possible? As a player, that is too difficult if you are not supposed to apply this Ayurvedic things continuously 6, 7, 8 years. That is too difficult to go into the higher level. So that is one important thing for me. And after, after marriage, after baby, every woman is little bit of like depressed, or it's not healthy or strong. But after marriage, after baby, also I am doing gymnastic or yoga with my kids. So everything thanks to the Ayurveda and all my team. Thank you.
Thank you, Neha, for your wonderful experience sharing. With Neha also, we have been learning through our trial and errors. You must have how our game selection process came to this level of to the perfection. And we have been treating all these athletes. Okay, so as all of them are working as coach in their game and their career. Now they have reached that level and that path of their career. So as coach, how you are propagating Ayurveda and to your kids and to your students? I want Bhushan, Neha, you summarize.
ठीक आहे. मगाशी मी बऱ्याच गोष्टी विसरून गेलो होतो बोलताना, तर ते आता काही गोष्टी मी बोलतोय थोड्या. पहिलं विसरून जाईल. पहिलं मी सांगतो की क्रीडाकुलमध्ये एक खेळाडू तयार करण्यासाठी फक्त प्रशिक्षक महत्त्वाचा नसतो, त्याच्या मागे बरीच मोठी यंत्रणा काम करत असते. एखादा राष्ट्रीय खेळाडू जातो तेव्हा ती 20 ते 25 लोक काम करत असतात. फक्त प्रशिक्षक नाहीत, तर क्रीडाकुलचे सर्व शिक्षक, आयुर्वेदिक विभाग, मानस विभाग असे बरेचसे आहेत. आणि त्यातील सगळ्यात महत्त्वाचं मी त्यांचे आभार मानतो, दिलीप काका, गायकवाड काका आणि सोमनाथ दादा. कारण की मैदान चालू होण्याच्या आधी ते पाणी मारून वगैरे ठेवायचे आणि आम्हाला खेळायला सहज हे व्हायचं, तर त्यांचे मी पहिले आभार मानतो. मी दुसरी गोष्ट अशी की संपूर्ण भारतात, म्हणजे मी आता बघितलं, आनंदादाशी सुद्धा मी चर्चा करत असतो किंवा बाहेरच्याही आता भारतातील बऱ्याच खेळाडूंशी मी बोलतो, तेव्हा कळतं की आयुर्वेदिक ट्रीटमेंट ही दिलीच जात नाही. म्हणजे इंटरनॅशनलपर्यंतसुद्धा आयुर्वेदिक ट्रीटमेंटच नाही आहे. म्हणजे आता मला माहीत नाही, बरेचसे असतील वैद्य, त्यांना माहीत असेल, पण माझ्या दृष्टिकोनातनं मी खो खोमध्ये तरी बघितलेलं आहे, देतच नाहीत आयुर्वेदिक ट्रीटमेंट. सरळ सांगतात की ॲलोपॅथिक, आणि इंजुरी झाली की आपण फिजिओथेरपी वगैरे आपण तिकडे जातो, पण आयुर्वेदिककडे का नाही, हा एक बराच मोठा प्रश्न पडतो. त्याच्यानंतर खो खो हा खेळ सांघिक खेळ आहे, ठीक आहे. त्याच्यामुळे वैयक्तिक खेळायला आपण सहज उपलब्ध करू शकतो, पैसेही मॅनेज करू शकतो. पण सांघिक खेळाची जेव्हा वेळ येते तेव्हा आपण मॅनेजच करू शकत नाही पैसे इतक्या लोकांचे. आणि मग लोक काय सांगतात की अरे बरं होण्यासाठी तू ॲलोपॅथिक खा, ते बरं होईल, प्रोटीन तू का, ते होईल. आता आम्हाला एक गोष्ट सांगतो आहारामधलीच, म्हणजे आता बॉडी रिकव्हरीसाठी आपल्याला प्रोटीन देतात आत्ता, ठीक आहे. तेव्हा आम्हाला खजुराचं पाणी द्यायचे, त्याची रिकव्हरी एवढी फास्ट होती ना, ती आता खजुराचं पाणीच मिळत नाही. म्हणजे आम्ही सांगितलं तरी लोक करत नाहीत ते, की नाही अरे आम्हाला इन्स्टंट कोणाचं मिळतं तर प्रोटीन मिळतं का, त्याची ॲड दिसते आपल्याला, पण खजुराच्या पाण्याची कधीच ॲड होत नाही. तर ती आपण सर्व खेळाडूंनी ती केली पाहिजे, अशी एक गोष्ट आहे. आणि दुसरी, क्रीडाकुलमधून आता मी 6 वर्षानंतर बाहेर पडतो. आपण कुठलाही खेळाडू जेव्हा 6 वर्षानंतर बाहेर पडतो, त्याच्यानंतर मग पुढे काय, म्हणजे तेव्हा मानसतज्ञ नाही राहत, तेव्हा आयुर्वेदिक विभाग राहत नाही, तेव्हा ही यंत्रणा कोणी म्हणजे त्यांचा दोष नाही, हा खेळाडूचा दोष असतो. मग हे पटवण्याचं काम कोणाचं? किंवा आता ही आयुर्वेदिक ट्रीटमेंट ही परवडतच नाही कोणाला. मी आत्ता एक खरंच सांगतो, म्हणजे तो मोठा एक हे आहे. मी आत्ता बस्ती जेव्हा घेतो तेव्हा कळतं की म्हणजे अरे त्या इंजेक्शनपेक्षा आपलं सुईचं इंजेक्शन बरं आहे, ते 5 रुपयात 10 रुपयात असं होऊ म्हणजे आता जास्त आहे, पण ह्याची 10,000 किंमत आहे, 15,000 किंमत जाते. पण ठीक आहे, आता माझा एक खेळाडू आहे विवेक ब्राह्मणे, त्याला स्कॉलरशिप मिळते म्हणून तो परवडू शकतं त्याला की तो 10,000 स्पेंड. पण बाकीच्यांचं काय? सांघिक खेळामध्ये एकच व्यक्ती महत्त्वाचा नसतो, तर पूर्ण 12 ते 15 लोक जे आहेत त्यांनासुद्धा हे महत्त्वाचं आहे. आणि हे क्रीडाकुलमध्ये आम्हाला सहज मिळायचं, सगळ्या गोष्टी सहज मिळायच्या आणि त्याची किंमत खरंच नसते, सहज मिळतं ते. पैसे पण बरोबर आहेत या गोष्टी, कारण तर लॉंग टर्म रिझल्ट देतो. पण आता सध्या एवढं म्हणजे महागाई पण एवढी वाढलेली आहे, तर तेव्हा कोणाला परवडत नाही या गोष्टी. तर त्याच्यावर उपाय काय हे म्हणजे तुमच्याकडनं ऐकण्यासाठी म्हणजे आम्हाला आवडेल, कारण की हे सगळ्यांनी सगळं सांगितलं, आयुर्वेदिक ह्या गोष्टी आहेत, त्या गोष्टी आहेत. पण याचे ड्रॉबॅक्स म्हणजे मला हे वाटतात की मी पटवून कसं देऊ लोकांना. जेव्हा मी खेळ घेतो मागे म्हणजे JPNVचाच आपला खो खोचा क्लब आहे, चिंचवडमध्ये एक क्लब आहे, जेव्हा मी त्यांना सांगतो की अरे आयुर्वेदिक ट्रीटमेंट असे चालायच्या, आमच्या शाळेत हे चालतं, जसं हिने पण सांगितलं की बाहेर नाही आहे, पण सगळं सांगतो, सगळं मान्य. पण जेव्हा ते करायला जातात ना बाहेरचे लोक, ते म्हणतात ते नाही परवडत आम्हाला या गोष्टी.
सगळ्या खेळातल्या खेळाडूंचा फायदा व्हावा, सगळ्या खेळातल्या खेळाडूंसाठी या गोष्टी अवेलेबल व्हाव्या, हा खरं मूळ उद्देश ठेवून आपण या 2 दिवसाच्या चर्चासत्राचं आयोजन केलं होतं. 25 वर्ष जे आम्ही करतो आहोत, ज्याचे आम्ही अनुभव घेतो आहोत आणि ही अनुभव जे हे इथे जे बसलेले आहेत ही खूप छोटीशी संख्या आहे. ही खूप थोडे आपण इथे जागेच्या उपलब्धता आणि या सगळ्या गोष्टीमुळे कमी बसवू शकले. हा अनुभव आज या व्यासपीठावरून सगळ्यांसोबत शेअर करण्यामागचं कारण हेच होतं की 25 वर्ष क्रीडाकुल नक्की अनुभव घेत आहे, क्रीडाकुलची मुलं नक्की अनुभव घेत आहेत. हा अनुभव सगळ्यांना घेता यावा, जास्तीत जास्त खेळाडूंना घेता यावा आणि जसं आत्ता भूषण म्हणाला तसं योग्य दरात घेता यावा, ह्यासाठी सुद्धा सगळ्याच वैद्यांनी एकत्रित येऊन काहीतरी ठरवण्याची वेळ ही नक्कीच आहे. जेवढे प्रयत्न खेळाडूच्या स्वास्थ्यासाठी आणि जेवढे प्रयत्न खेळाडूला चांगल्या पद्धतीने आरोग्याच्या आयुर्वेदाच्या सुविधा मिळाव्यात म्हणून करायचे आहेत ते आम्ही आमच्या परीने नक्कीच करतो आहोत आणि करूतच. तो म्हणजे तिथे कुठे शंका घेण्याची जागा नाहीच. एवढं तरी आता तुला नक्की सांगेल.
आयुर्वेदिक घेताना एक लक्षात ठेवा की मला प्रतिमा नेहमी सांगते, म्हणजे जी आपली माझी विद्यार्थी आहे, शिस्त खूप महत्त्वाची असते. लोक काय करतात, 6 दिवस त्यातले 2 दिवस खाडे करणार, बस्ती घेणारच नाहीत, मग नंतर म्हणणार की आम्हाला रिझल्टच मिळत नाही. असा आयुर्वेदिकचा रिझल्ट कधीच मिळत नाही. तो प्रॉपर आणि त्यांचं म्हणजे सिस्टीम असते की आहार कसा तुम्हाला आधी घ्यायचा आहे, मग नंतर त्याच्यानंतर तुम्ही किती फॉलो करायचं आहे, या गोष्टी खूप महत्त्वाच्या असतात. नाहीतर आपण फक्त म्हणतो लॉंग टर्म रिझल्ट मिळतो, 6 दिवस मी केलं आयुर्वेदिक आणि नंतर महिनाभर सोडलं, असं कधीच नसतं. आयुर्वेदिकला पूर्ण ती 1 महिन्याचा जो टाईम असतो किंवा 2 महिन्याचा, हे जसे वैद्य सांगतात त्याच्याप्रमाणे आपण तो घेतला तरच तो आपल्याला रिझल्ट नक्की मिळू शकतो, एवढं नक्की सांगतो.
आय थिंक नेहा हॅज टू से समथिंग ऑन दिस टॉपिक.
मला आत्ताच सांगितलं, आता तू मराठीत बोलणारस काही झालं तरी. ओके. सो ॲज अ प्लेअर म्हणून मी माझा अनुभव शेअर करा. आणि आता मागच्या 6 वर्षापासून मी ॲज अ कोच म्हणून काम करते. माझ्या अंडर जवळपास 350 मुलं ट्रेनिंग घेऊन झाले, ज्यांना आपण रिदमिक जिम्नॅस्टिक आणि योगा दोन्ही शिकवतो. काय होतं, कॉम्पिटिटिव्ह लेवलला जेव्हा आपण जायला लागतो तेव्हा प्रॅक्टिसचा टाईमसुद्धा वाढतो. हा कमीत कमी आमचा 6-7 तास ह्या लेवलपर्यंत खेचला जातो. आणि माझ्याकडच्या मुलींचं एज कॅटेगरीज चालू होते 2.5, कारण रिदमिक जिम्नॅस्टिक हा गेमचा स्पॅन खूप छोटा आहे. तो 2.5 टू 19-20 वर्षापर्यंत हा गेम चालतो. आता पॅरेंट्स म्हणून मला खूप वेळा असं म्हणतात की मॅडम तुम्ही एवढं लवकर का हा गेम चालू करता, कारण अंडर 8 अंडर 7ची पहिली कॉम्पिटिशन त्यांना खेळायची असते. आता ह्या वयामध्ये जर का म्हणजे अंडर 5 अंडर 6मध्ये त्यांना इंजुरीज झाल्या तर काय, आणि ह्या इंजुरीज होऊ नये सगळ्यात महत्त्वाचं तर काय, ह्या दोन्ही गोष्टींवरती आम्ही काम करतो. कारण आता ॲज अ प्लेअर म्हणून हे आपल्याला मला ऑलरेडी कळलं की बाबा इंजुरीज काही गोष्टींनी होणारच होणार आहेत, त्याला समहाव तुम्ही नाही म्हणूच नाही शकत. जिथे ओव्हर बॅक बेंडिंग करणार तिथं स्पाईन इंजुरी बॅक इंजुरी होणारच आहे. मग त्याला ते होऊ नये म्हणून आम्ही म्हणजे मी स्वतः माझ्या मुलींसाठीच्या ट्रीटमेंट आम्ही आधीपासूनच चालू केल्यात. त्यांची जसा परफॉर्मन्सचा स्पॅन वाढत जातो तसं आम्ही त्यांच्यावरती आधीपासूनच ट्रीटमेंट चालू करतो. पर्सनली मला विचाराल तर मी होमिओपॅथी ॲलोपॅथी, आय एम सो सॉरी हे माझं मत आहे, पण मी ह्याच्यावरती नाही आहे माझा विश्वास. त्याच्यामुळे मी माझ्या मुलींचं वय कमी जरी असलं, माझा स्वतःचा मुलाचं वय 2 वर्ष होतं तेव्हापासून मी त्याला आयुर्वेदिक ट्रीटमेंटच देते. माझ्या घरामध्ये माझे आई बाबा नवरा सगळ्यांना आम्ही आयुर्वेदिक ट्रीटमेंटच देतो. सो म्हणून मी हा अप्लाय मी माझ्या मुलींवरती ज्यांना मी जिम्नॅस्टिक शिकवते त्यांच्यावर सुद्धा मी हेच अप्लाय करते. अमृताताईकडे किंवा सौरभ दादाकडे आम्ही त्यांना ज्या काही इंजुरीज होतात, सपोज जिम्नॅस्टिक करताना कधी कधी हॅमस्ट्रिंगला इंजुरी होते किंवा खूप दमतात. सो पॅरेंट्स असं म्हणणं असं, ताई तू डाएट का देत नाही, म्हणजे डाएट दिलं तर ह्यांच्यामध्ये लवकर ताकद येईल. पण त्यांचं वय हे हार्डली 6-7 त्यांचं ग्रोनअपचं वय असतं. त्यांना एवढ्या लवकर डाएटचा मारा करणं हे मला पर्सनली पटत नाही. म्हणून त्यांचं स्पेसिफिक काउन्सिलेशन करण्यासाठी त्यांना एक्झॅक्टली कुठली ट्रीटमेंट कोणत्या वयामध्ये चालू करायची, त्यांचा डाएट कसा असला पाहिजे. आणि जे मी म्हणते की आम्हाला कदाचित नस्य बस्ती हे सगळं 5वी-6वी पासूनच चालू झालं होतं. त्यांना माहिती होतं की आमच्यावरती त्याचा काय फरक पडणार आहे, पण ॲज अ प्लेयर म्हणून आम्हाला माहीत नव्हतं की बाबा हे काय करताय तुम्ही आमच्यावर. तर हेच माझ्या मुलींच्या बाबतीत होऊ नये म्हणून त्या पॅरेंट्सची आणि त्या मुलींची पहिलंच आम्ही त्यांचं इंटरॅक्शन सेशन ठेवतो, ज्याच्यामध्ये हे सांगतो की हे असं असं केलं तर हे होईल. इंजुरीज टाळायच्या असेल आणि परफॉर्मन्स वाढवायचा असेल तर काही गोष्टी या केल्याच पाहिजे. जसं आठवड्यातनं 1 किंवा 2 वेळा मसाज केलाच पाहिजे, कारण बॉडी फ्लेक्झिबल व्हायला लवकर मदत होते आणि हॅमस्ट्रिंगचे मसल्स शक्यतो जास्त फाटतात. हॅमस्ट्रिंग पूल लवकर होतं, लोअर बॅक इंजुरी लवकर होते, तर ते नाही झाले पाहिजे. जसा इव्हेंट वाढत जातो, टायमिंग वाढत जाते, तशी ताकद भयानक लागते आणि मग त्या वीक पडतात. मग आता पॅरेंट्सचं म्हणणं असं पण असतं की तुम्ही नुसतं खेळच करतात. बाबा आमच्या वेळेस ठीक होतं, सकाळी 7ची शाळा ते रात्री 7पर्यंत. आमच्या पॅरेंट्सना माहिती होतं की हे स्पोर्ट्समध्येच करिअर करणार आहेत. पण आजकालच्या पॅरेंट्सला असं वाटतं की नाही बाबा हे संध्याकाळचं फक्त ग्राउंडला जातात आणि अभ्यासामध्ये पण तेवढेच एक्सिलेंट लेवलला असले पाहिजेत. मग हे 4 तासाच्या प्रॅक्टिसनंतर घरी जाऊन झोपले नाही पाहिजेत किंवा दुसऱ्या दिवशी उठून प्रॅक्टिसला आले पाहिजेत. तर मग त्याच्यासाठी त्यांचा डाएट कसा असला पाहिजे आणि त्यांची औषधं कोणत्या प्रकारची असली पाहिजे ज्याचा साईड इफेक्ट होणार नाही. खूप वेळा मला असं वाटतं की आपण जे पटकन इंजुरीज रिकव्हरी करायला जातो, जे बाकीची औषधं खातो, त्याचा लाँग टर्म किती उपयोग आहे. तुम्ही 5-10 मिनिटासाठी किंवा त्या आठवड्याभरासाठीचा विचार करता की आत्ता मी औषध खाल्लं आणि मी एकदम ठणठणीत बरा झालो, त्याचा साईड इफेक्ट हा लाँग टर्म कधी दिसणार आहे, तो किती वेळ राहणार आहे बॉडीमध्ये, ह्याचा पॅरेंट्स आजकाल विचार नाही करत. सो ॲज अ डॉक्टर म्हणून आपण त्यांना पहिलं सांगतो की तुम्ही सेशन घ्या, तुम्ही हे सांगा की बाबा आयुर्वेदच का अप्लाय करायचं आणि हे बाकीचं का नाही अप्लाय करायचं. सो माझ्या ज्या काही माझ्याबरोबरच्या मुली आहेत, काल कदाचित तुम्ही त्यांचा परफॉर्मन्स बघितला असेल रिदमिक जिम्नॅस्टिकच्या, अगदीच लहान आहेत, नर्सरी सिनियर KG अशा मुली आहेत, पण एक्सिलेंट लेवलचा परफॉर्मन्स करू शकतात, कारण आपण त्यांना खेळ आणि आयुर्वेद या दोघांचीही जोड देतो. सो ॲज अ कोच म्हणून मला विचाराल तर मी माझ्या मुलींना आयुर्वेदिक शिवाय दुसरा कोणताही डॉक्टर आजपर्यंत तरी सजेस्ट केला नाही. आणि माझ्याकडे अजून एक अशी स्पेशल केस आहे जी मी अमृताताईला सांगेल नक्की एक्सप्लेन करायला. तिचे पाय इनवर्ड आहेत. ओके, तिने आत्तापर्यंत सगळे डॉक्टर करून झालेत, पण समहाव तिला फरक नाही पडला. मग तिला कोणतं सांगितलं बाबा तू जिम्नॅस्टिक जॉईन कर, मग तुला तो फरक जाणवेल. ॲज अ कोच म्हणून मी तिच्या फ्लेक्झिबिलिटीवर किंवा बॉडी अलाइनमेंटवर काम करते. पण अमृताताई तिच्यावरती अजून स्पेसिफिकली काय ट्रीटमेंट करते आपण हे ताईला विचारूया.
For her, that candidate, we are doing Agnikarma we have done on her and strengthening part for following her diet and massage. So these two, as she is very young, we are doing all these treatments for her.
And because of that, I think she is going good now with the performance also. She is just first standard, I think, not in the first standard also. So we are doing good for that.
थँक्यू नेहा. आयुर्वेदाच्या भाषेत सांगायचं तर आत्ता भट्टी तापायला लागली आहे आणि बट अनफॉर्च्युनेटली वी आर रनिंग अगेन्स्ट टाईम आणि आता पुढचं सेशन लगेच आपलं प्रॅक्टिकल सेशन आहे. त्याच्यामुळे आपल्याला आत्ताचं हे सेशन थोडक्यात थांबवायला लागणार आहे. आय थिंक वी आर एंडिंग ऑन अ गुड नोट. वॉट दीप्तीताई हॅज सेड, वॉट नेहा अँड भूषण हॅज समराइज, की आपल्याला सगळ्यांना आता इथून पुढे हे सगळं स्प्रेड करायला लागणार आहे, याचं व्याप्ती वाढवायला लागणार आणि त्यासाठी आजची कॉन्फरन्स आहे. We have started in Kridakul with the assumption, with the hypothesis that Ayurved can be useful for the sports persons. असा एक हायपोथेसिस घेऊन सुरुवात केलेली होती आणि आता 31 रिसर्च पेपर्स काल आपण पब्लिश केले आणि हे सगळे लोक समोर बसलेले आहेत की जे म्हणतायत की आम्हाला उपयोग झाला आहे आयुर्वेदाचा. सो असे 2-4 आपल्यासमोर दाखवायला म्हणून नमुने आहेत की ज्याच्यामधनं आपण हे देशभर कदाचित याचा स्प्रेड हा वाढवू शकतो. हे करण्यासाठी म्हणून आपण सगळेजण पुढचा काही काळ काम करूयात आणि अर्थातच हे सगळेजण आपले प्रोपोगेटर्स किंवा प्रमोटर्स म्हणून आपल्याच्या सगळ्यांच्या बरोबर कायम असतील. वी विश ऑल ऑफ यू द बेस्ट सक्सेस. खूप चांगले यशस्वी तुम्ही सगळ्यांना इथून पुढच्या काळातही होत राहाल अशा शुभेच्छा आपण सगळ्यांना जोरदार टाळ्या वाजवून या सगळ्यांना देऊयात. आणि त्यांनी दिलेले सजेशनसुद्धा आपण नक्की पुढे घेऊन जाऊयात असं आपल्या बाजूने सगळ्यांच्या बाजूने त्यांना खात्री देऊयात.
आत्ताचं सेशन आपण आत्ता इथेच संपवूयात. 5 मिनिटात लगेच प्रॅक्टिकल सेशन पुढचं आपण सुरू करूयात. थँक्यू एव्हरीवन.
Please be seated for the next session. We will have a 5-minute break.
हेलो
सर वो मेरा क्वार्टरी का बॉक्स किधर रखा है?
हेलो जी, हेलो जी.
लगेच फरक पडला.
हो चालेल हो
हो हो संजोदा पेपर कुठे आहेत रे? इकडे पिशवी सर शिरोधारा घेऊ का इकडे की नको? शिरोधारा लेणार आहे? शिरोधारा नाही दाखवणार. नको ना ते कशाला आणायला लावलं मग अर्धे म्हटलं ते शिरोधाराचं सगळं आणायला आहे आम्ही कॉलेजमधून. ते स्थानिकाला दुसरं आहे ना आपल्याकडे. बरं स्टँड आहे ना. स्टँड आणतो का शिरोधाराचं? ते स्टँड
सर
Done kya? Okay. So, looks like, you had a good session, you had a good listening session of these star athletes of Nyan Prabodhini. But I think you've been sitting for a long time, right? And they say now that sitting is the next cancer. Okay, sitting is the next cancer. So why don't we all stand up? Leave your bags, your, purses, mobiles. Let's just, disconnect with whatever we have in our hands. Okay. So, keep some space for you all. Okay, I think these are very flexible chairs, so you can move them. Make some space. And we are going to do a nice, fun routine, okay? Do you want to do or no? Come on, yaar. Yes, lovely. So, this song goes like this. It is, I have a little house, and I have Neha, she's very enthusiastic, okay, always. So, it says, I have a little house. So, how do you show little house? You show little house like this. You have to do with me, okay? No cheating. Like this and like this, okay? I have a little house. Kisi ka itna bada hai. Are like the little house hai na. Okay, like this and like this. And then the smoke is rising, okay? Smoke. So, like this and like this. Okay, Shaktiman. Yaad hai na? Shaktiman, okay, very good. Okay. And then I'm knocking at the door. How do you knock at the door? Like this and like this. यहाँ पे तुम अपना स्टाइल यूज कर सकते हो. ऐसे बैंग करना है, ऐसे लात मार के. Use your style, okay? Knock like this and like this. And the last one is, you're going to polish your shoes, okay? किसने नहीं किया polish यहाँ पे? ये तो shoes ही नहीं पहन रहे. Okay, like this and like this. Bachas, it's for you also. Stand up. Yeah, shabash. Okay. And they think they are the, guest of honor. Okay. So got it? So we will do, I have a little house. How? Like this and like this. And the smoke is rising like this and like this. And we are knocking at the door like this and like this. And then polishing your shoes like this and like this. Fun, right? So now, see, without any catch, I don't do anything, okay? So there's a catch. There's going to be music. You have to follow the music. And simple, follow us. Keep up the pace, okay? Pace is very important. You need to get your heart rates up. And like I said, don't look here and there. मुझे कोई देख रहा है क्या? No judgments. Nobody is judging, okay? So dance like as if, nobody is watching you. Yeah, can we have the music? Ready? Yeah, come on. Sound. We'll march a little.
I have a little house like this, and the smoke is rising like this, I'm knocking on the door like this, and polishing my shoes like this, 1, 2, 3, we're going faster. Pay attention, we're going faster. I have a little house like this, and the smoke is rising like this, I'm knocking on the door like this, and polishing my shoes like this, 1, 2, 3, we're going faster.
Come on, guys, speed up.
We're going faster. I have a little house like this, and the smoke is rising like this, I'm knocking on the door like this, and polishing my shoes like this,
Faster, guys.
Pay attention, we're going faster. I have a little house like this, and the smoke is rising like this, I'm knocking on the door like this, and polishing my shoes like this, 1, 2, 3, we're going faster. Pay attention, we're going faster. I have a little house like this, and the smoke is rising like this, I'm knocking on the door like this, and polishing my shoes like this, 1, 2, 3, we're going faster. Pay attention, we're going faster. I have a little house like this, and the smoke is rising like this. this, like this. I'm knocking on the door like this, and polishing my shoes like this, like this. 1, 2, 3, we're going faster. Pay attention, we're going faster. I have a little house like this, and the smoke is rising like this, like this. I'm knocking on the door like this, and polishing my shoes like this, like this. I have a little house like this, and the smoke is rising like this, like this. I'm knocking on the door like this, and polishing my shoes like this, like this. Like this, like this.
Okay, we are going to breathe in deep, breathe in. Breathe in through your nose, exhale. Yes, very nice. Breathe in, exhale. जो कुछ हिले नहीं उनको कुछ काम करना है, okay? Okay. I need the breathing. Okay. Thank you so much. You were wonderful. Yeah, thank you. Okay. I think you must have seen up a slide on screen. If you need any active breaks like this, or you need any workshops for your team or any team building activity, you can just get in touch with the number that was reflected, okay, on screen. So thank you.
Wonderful. Wonderful. You are rocking, man. You just rocked it. Nice. Now I get to know how Devrakar sir wanted you to be here. So nice. Rightfully, you proved that point.
Hello, hello.
So now we are going to present the gist of the entire National Conference of Sports Ayurveda. We are going to take away some practical sessions, and we are all waiting for that. Just give me 5 more minutes. We are just arranging the tables, and we have to show you all the karmas, right? So till that, I wanted to share with you something. I was very touched with Devrakar sir's speech few minutes back. He rightfully mentioned that more Ayurvedic doctors must venture into this field of sports Ayurveda. So as we know that you may gather any amount of knowledge, but it is a waste if it is not applied, right? In our Ayurveda Shastra, all the Vaidyas will agree with me that there is one shlok when we talk about the qualities of the doctor. Daksha Tirthartha Shastrartho Drushta Karma Shuchi Bishak. That means a doctor has to be alert. He has to have a specific and very detailed scientific knowledge, and the main word that is Drushta Karma. So you may gather any amount of knowledge, but once you've seen that activity, okay, so the same lies with the sports person and the coaches also. Now, once you will see these activities and once you will come to know that what all modalities or treatment facilities are available in Ayurveda for sports injury management and other things. So that will make you choose Ayurveda instead of just popping painkillers, okay, thoughtlessly. So just bear with us for a few minutes and we'll be back with the session. Yeah. Curtains open. And for this practical session, we have Dr. Rajesh S. We enjoyed his afternoon session very well, and we want so much more to hear so much more from him. So now he's going to guide us with the practical sessions. I'll once again tell his details. He is Ayurveda Charya, medical officer at the Government Ayurveda Hospital, Ernakulam. His contribution to sports Ayurveda medicine is exemplary, ranging from acupuncture to marma therapies to having participated in the Commonwealth Games. His achievements are varied and outstanding. We also have with us Senior Dr. Mahesh Patil. He is MD Ayurveda from Kerala. He is also Ayurveda Acharya. He is, apart from being Ayurveda Acharya, he is also MA in Sanskrit and Diploma in Yoga and Ayurveda. He has been an ex-Ayurveda physician at the Krida School for many years. For more than 18 years, he has been doing pure Ayurveda practice at his own Vivekananda Ayurveda Chikitsalaya. He is also Ayurveda consultant at Tanman Ayur Research Center. He's been an ex-professor at Bangalore RGH University. We also have Vaidya Nilesh Shirke, who is also an Ayurveda Acharya. BMS passed out in 2008 from the prestigious Bharati Vidyapit. He is practicing pure Ayurveda in Chinchwad for the past 12 years. We also have on dais Dr. Saurabh Deshmukh. He is physiotherapy consultant at Krida School. He is the head of the physiotherapy department. DSK Shivajian's Football Club. He was the head of the physiotherapy department, Shivajian Football Club from 2011 to 15. Kerala Blasters Football Club from 2015 to 2018. Dabang Delhi Kabaddi Club from 2017 to 2023. Haryana Steelers 2018, and founder and director of Ayur Physio Wellness Center at Nigdi. Please fasten your seat belts now. We are just about to begin.
A very good afternoon to all of you. After a good lunch, we are slightly sleepy. Okay. Okay, good. Okay. And here we are going to dance and you are just going to watch. Okay. We are here with our team. All are here. This is my classmate PG, Dr. Jalaluddin PPT is here with me from Kerala. He has already presented a paper here. And Dr. Saurabh, BPT, and our colleagues are here with Mahesh Patil, and all are here. I am very happy to this much people never comes with me in classes, so I am happy. Okay.
So I take this opportunity and call on stage Shriyut Bhagwan Sonavne, He's NIS
Now-
coach, Kabaddi. Sir, 1 minute. Felicitations. He's serving at Jnana Prabodhini Navnagar Vidyalaya and Kridakul for the past 32 years. So Bhagwan Sonavne ji, please, I want you to felicitate. So we can call Aditya Shinde Dada. If he's not available, Aditya Dada. Okay, he's coming. Both can join, and I want, yeah. Aditya Dada, Shriyut Aditya Shinde is a center executive at JPNV, and he is also been serving Jnana Prabodhini for the past more than 15 years. Sir, अच्छा दोघे या. Sir, please तुम्ही राजेश सरांचा सत्कार करा. Aditya Dada, you can felicitate Dr. Mohammed ji. Sir, थांबा. सगळ्यांचे सत्कार. You can felicitate Dr. Mahesh Patil, please. Okay. Dr. Mohammed ji. Dr. Saurabh Deshmukh. Aditya Dada. And Dr. Nilesh Shirke. अजून एक. Thank you for being a patient audience. Yeah. Please give them a loud applause. They're all going to show us what we are here to see. Okay.
We have, in the morning session, we have just gone through the protocol. You just saw it. We will once again revise that. And each protocol, we saw some treatment techniques mentioned in that. So most of them, we will brush up with that. With those techniques, we will be showing here for your convenience, because after this session, when you go home, you can remember this for this. Like that, we can easily pick up so that you can start it immediately at your. You see, delayed onset is Lepanam. We have said it Nagaradi with Dhanya Amlam. Okay, and that we will go on with that. Piju and Suji Vedam. The cervical postural syndrome, Marma manipulations are said. So one volunteer, anybody. You can put a, I think one small stool is more. Stool. Chair. So I can show it from the chair. Make him sit, show the neck. Yeah.
So we are having two parallel sessions here. Like Dr. Rajesh is showing us the marma manipulation. Hello.
We have to check on the marma manipulations. Marma points are there. We are normally these are 2 points. Then this is Pidari. It's the Tamil Varma I am more accustomed to. So the points are there. These two points here, 2 points. These are the attachment of simple trapezius muscle here comes below the occipital prominent below. So the 2 points are very important. You all can experience just now. You see, just hold like this. You hold like this the thumb part, you have to fix just below the area where the hair ends here. You just rotate outward and inward 3 or 5 times. And then release and look. Release and look. You are looking differently, no? You feeling difference, no? That much importance is there, that marma point. Most of the marmas on the head, you yourself can do it and experience this. So first we release this point. The postural syndrome, in most of the neck conditions, we have to release these points. Then this pidary, that is the center part, that area. Then this is C7 area, C7T1 area. That area you can release like this rotation, outward and inward. Like that, there's a normal. For when it comes the part of children, you must be very cautious in your hand movement and the pressure you apply. You very softly only you have to apply. Don't put more pressure, which is bearable. And even less than where you can reduce, that much is enough in marma techniques. When for manipulations also, for stretching, and the stretching part is for the neck, neck part is there, neck for the side trapezius, scalene, then levator, those stretches you have to start. You start and make the patient ease with the muscles, and then only we go for the other techniques, means kiri or whatever it may be. But even taping, you can start with the techniques after the stretching techniques. Dr. Saurabh, show the neck taping technique in the neck.
These are called kinesiology tapes, okay, that will support muscle fibers. Now I am doing a taping for trapezius muscle.
Even in the wry neck condition, acute wry neck, after manipulation you can put the tape. If there is no medicine or you can't apply immediately on the field, on field management, you can do this and leave the athlete. And after that, when they return, we can go for lepana or oil techniques or whatever. Now we do this. This is a very good taping technique which can be immense help for the athlete. Mentioned in that techniques, Suji Vedam, that is a needling technique. You can, if you know acupuncture techniques, you can apply that for immediate result like that. Then pain spray, you can apply. IR lamp, if you have, you can do IR lamp. And in chronic conditions, we use Lepanam. Lepanam, we have to prepare with the powder and dhanyamlam. Dhanyamlam is a fermented preparation of medicated fermented preparation of grains and laja, means rice flakes and like that. So that is a immediate inflammatory reducing agent, that liquid. That liquid on dhara will reduce the inflammation. So we are using that liquid. Even plain water is okay because the medicinal properties of the powder will reduce the inflammation. But adding dhanyamla to that will more easily reduce the inflammation. So we are using this this dhanyamla with the powder. We can make it into a lepa. This is the powder added. Then the paste, little more you add. Then you add it. This is nothing, we take the powder, whichever powder. It depends on the, if there is a burning sensation, we put different, or pain is there, we put different, like that, Vada, Pitta, Kapha, you know all these differentiation according to the drug. Which drug you have to choose, you take the drug of choice with the powder as a powder form, then you mix it with the dhanyamla. So that is made into paste. Then lepana, that normally you have to keep at least from 1 to 3 hours. Okay, so that inflammation can be reduced. Then you can apply a cotton cloth over it and then tape it with the microporous tape. We can apply it, no? We have to show application. You can apply it like this, just apply it, okay. Yeah, a little more thickness we need. You can say chapati thickness. Okay, very easy to understand. One chapati thickness or like that. Okay, whichever thickness you relate it with dosa, masala dosa, then the patient and all will be happy. Because at least masala dosa is, no, they are not getting it here. Okay, so that is here. So I normally tell people like that to understand. Otherwise, what happens is, they will go home. I normally seen in our IP also, we ask them to put the leba, they will just paint it. From neck pain is there, but they will put it till down. Okay, where it is, hand pain is there. If excruciating pain is there in the hand, radiculopathy is there. Not necessary to put in the hand. You put it here in the little adequate thickness. That is enough. And if they have to move about, and then we can put a small cotton piece or like that, or a gauze. Now this, you see, you don't have any other thing. You take a tissue paper, okay. What the purpose is, you have to keep that there, okay. It will be there. It will be sticking on there. Keep it there, put the dress, you can move on. Okay. Nothing necessary to lay down like that. You enjoy your everything with the labor, that's enough. And continuous staring TV and sitting and seeing film, that is not allowed. Because again, it will create a spasm there. So moving about is okay, that you have to judiciously tell them. This is one type on the cervical area. Again, wherever leba is mentioned, you can apply this. Okay. And one more part is, we apply directly now because we didn't show it in the stove or heat it. You have to heat it. Okay. You have to remember to mild heat is necessary. Mild heat you have to apply it. Okay. So lukewarm leba has to be applied like this. Then apply a small covering. And if you want to tape it, you can tape it, and so it doesn't go out or like that. Okay. On the arms also, you can apply, make a bandage like that. Knee joint, lumbar area, ask them to lie down. You can. And if mostly the patients say, I am alone in house, nobody is there to do. Very simple. I will ask them to put a small butter paper, take butter paper and spread the leba, take it and do it. Then you make a small cloth to cover it. And you run or jump, nothing, no problem. But the leba must be there. That is very important. So don't, when we will feel that, oh, they are not going to do, don't do that. We have to find out the techniques, suggest them, make it them to do. And ask them, don't come if you don't do. Don't come back if you don't do. Because we must be very specific enough to tell them that this has to be done for the cure. Otherwise, they will not do. Because they will put the heat, and an oil is going to be following this after removal. So they will put the oil, put the heat, that's all. The leba, they don't go for doing. But this is the main part where it cures. Okay. Remove it and now you see in that talam. Talam is nothing as the cervical. The brekma part we put oil and this powder. That in a spoon. One spoon. This is piju next. No, for talam. Talam, no, not necessary. Spoon. Powder is maybe. This is enough. Where is the bowl? No, 1 spoon and powder. And the oil, muruganna. This is enough. See, you take a spoon. You take a spoon, okay. Put 2 pinches of the powder. Rasnadi churnam we are using, kachuradi we are using, and then 2 pinches is added in, is put in the spoon. Then this is muruvanna, okay, or Shirabala is used according to the conditions, okay. So we will add that up to 1 spoon oil, 2 pinches powder. Okay. This we will heat. Okay. Heat in a candlelight or any stove or like, and make it cool. Okay. Heat it. Just heat it. Then cool it. Then we apply on the head area. There we pour this with this powder, and that is a semi-paste like condition, okay, so that the oil stays there, okay, oil stays there with the powder, okay, so like a tissue paper. I'm just applying it here. You can mark it by the level of ear pinna. Ear pinna, you can see the topper apex of the pinna. You can take the level from there. You apply there this piju. You apply there. You spread it on the pregma. Leave it for half to 1 hour. Okay. So this is good for the cervical condition. But in cervical inflammatory condition, you have to go for Kabahara oils. That is why we used Muruvanna here, okay. Or Asana Eladi, Asana Villadi, like that, a range of oils are there. Shirabala, we don't go for this cervical condition because it is Brahmana. It is Brahmana in property. So Shirabala we don't put. For sleeplessness, Nidra Nasha, we put Shirabala. And if the patient is trying to normally sleeping at 10 o'clock and sleep is not coming, you put at 9:15 this Shirabala with this, and 9:30 she will be lying down, okay. That is a sleep inducer, okay. So that is good in diabetic neuropathy condition, sleeplessness, these conditions, Shirabala can be used. I am removing this now. That is not used for him, so just remove it, no need to wash and all, okay. Just remove it like this tissue paper, that is enough. Okay, so that will not go down deeper, that's why remove. In the same way, Piju is returned. Piju is a technique in which the same technique you apply for longer time, okay, for 1.5 hours, like that, and also for bandage or like that in the knee joint, tennis elbow, after the inflammatory condition and the pain reduction, or even during the pain, you can apply Piju like this, the knee joint and all. You are leaving the same thing. If oil has to be there for more time and more quantity of oil has to be there, in cervical conditions of transverse myelitis or cervical contusion injury of the paralysis of the limbs, and in that conditions we give this Piju over there. It is not mere talam for little time only, and also the talam is done before the kiri, potli treatments. Before the, if Shirabala is kept on the head to reduce the heat, more not generating in the head part. Urdhvanga, more heat is moving from the body during the Kiri treatment. Kiri is hot treatment. So protect head from the heat. The talam is done. Talam is kept for with the powder, we keep the talam and then we do the treatment. After the treatment, we remove the talam and apply the powder like this. Okay. For Piju means it is a treatment modality. It is more time we are keeping the more quantity of oil itself. We are not using powder. So we are not using Rasnadi or other powder here, direct oil. Okay, so oil is soaked and kept in the Brahma area. Okay, that itself you can keep it in joint area where there is degenerative condition or flexibility. We want to improve more flexibility or like that. Like Ubanaha, we can put this cotton, soak it there, keep it there for more time. Okay, so this is Piju and Talam and Marma manipulations like this. Lepanam we have finished. Then we go for the next. You see, in a rotator cuff tendinopathy, Lepanam we can put. Okay. So Lepanam we are doing with Ruksha Kiri. Kiri, local Dhara is said and Kiri is said. So these are all preliminary treatments. Okay. It is not a secondary or later treatment. When the patient comes with a rotator cuff tendinopathy, we have to examine and then we are asking them to put the Lepana later at home or we have to put it and bandage it and leave. Okay. Before that, we will show the Kiri treatment, Dhanya Kiri. Kiri, this you can
Please. Mahatodi. Sir, t-shirt.
shoulder remove करना.
T-shirt. T-shirt. मांडी घालून दिस.
Local Kiri we give means in our clinic condition, if we are running our own clinic or like that, or we have other therapists to do the Kiri, we can ask them to do the Kiri. This is powder Kiri. Ruksha Kiri means dry. Okay, dry Kiri we do with the powder. Churna Pinda Sweda we say. So we can heat it. This must be on a stove like this. Okay. On stove we are putting 2 Kiris. When it is heated or make it in a low sim heat, then we apply this Kiri. Don't directly put, first of all you do it. You have to look the temperature this way only, not this way. Okay. So this will, by this method you can know the exact temperature. Okay. So when we do like this, don't put it there. So that is all. So we it's okay. Then we can little more. Even if it is children, we have to take care more. Then if you are not you can't bear with the heat, you do here. Okay, on the table. Okay. Then you check it with the hand, very low heat. Don't put the Kiri there itself. You can need only 1 Kiri in local treatments. So you just touch it, then check it like this, then put the Kiri there. Okay, like that you can slowly touch the Kiri. And so the Marma points in shoulder tendinopathy is this area, this tube area. Then shoulder infraspinatus, supraspinatus area, there is a point. So like that points and rhomboid. This area you have to cover, teres major, teres minor. The muscle group you must be thorough. Otherwise don't do Kiri. Okay. Just you are doing rubbing, this thing, that thing, pulling. What you are doing, simply time waste. Okay. Very easily you can take care of this thing. Very systematically you go with the treatment. What you are doing, where you are putting the Kiri, you must know. Otherwise don't do it. Simply you are doing, I am now improving or removing the inflammation. You have to do it upward. Okay. It is not downward. So even if you are doing mild, you do it upward. The pressure is only upward. Then you are simply taking like this, then again doing. The techniques are different in different area. But if you have a good knowledge what you have to do, you do it with Kiri, that's all. You can do it with hand also. You heat it here. No, you can, simply, you can massage like this, the upward massage. You see, Marma experts do all these things very faster. Okay, they will. You are seeing only massage, but what they are doing, you don't know. Why? Because you don't know the points. But if you know the points, you will closely watch. You can know that they are putting pressure here while pulling, like this. Okay, and upward only, then pressure comes. Then like this. Okay, so the pressure has to be given aptly, slowly, and that will be better. That you have to do with kiri. That in the back area also like that, we can exactly do and get the result what we need. So this is the Ruksha kiri. After Ruksha, when we touch the patient, the feels or we feel that it is heat or hot, then stop it. Don't do more, not necessary. More heat is not at all necessary. Then you apply the lepana. Okay, the lepana you heat it and then apply lukewarm lepana there. Then you put a bandage or a tissue paper or leave it for 3 hours or like that. Then remove it and then apply a mild oil. Either liniment type of oils, that is painkiller oils are there with the extract of grass, that is menthol oils are there. Local we will get sallaki oil, sallaki liniment, the dabar ka hai, rheumatil hai. Aisa oils you can apply there, okay, upward. So that will be pain relieving. So you can do it for 2 or 3 days and then we move on to oil treatment. In that you can apply Muruganna. The same kiri with the elakiri you can apply. The elakiri, that is Jambira. So if it is a frozen shoulder, okay, this will not move like this and all. It will be moving only till here. So the flexibility has to improve. But before that, we have to make sure that the shoulder has been treated, means pain and inflammation is reduced. After that, you take this, this is herbal leaves potli. So that you can use appropriate oil, heat it, and then apply with that oil. Very in a low heat, you can apply that. Massage it, or on the knee joint, shoulder joint, elbow, lumbar area, everywhere, for increasing the flexibility. That must be in your mind. Okay, it is not removing the inflammation immediately and all. It is slow reducing of inflammation. But we have reduced inflammation by putting dry kiri and lepana. And after that only we are taking this. We are switching over to herbal leaf kiri. And just between this there is Jambira Vinda. Jambira is, that is we have to we have to create a rate in the mind of each kiri, the Rukshada or the Snigdada. Which kiri is more ruksha, which kiri is more snigdha. Like that, we can change the texture of that kiri or understand according to the condition. We have to change the kiri and use it. That will be better. So even in steam, you can on the steam you can do this kiri. You can apply this. Okay, not direct heat. Apart from that, you can apply fomenting type of kiri like that. So there are different types of kiri. Don't worry on those things. Just think what it is doing there and apply the, look for the condition where it is done, which have to be done. You can create your own protocol, but it must be a scientific according to the condition. Okay. Kiri, first we reduce the inflammation, then we improve the flexibility or movement ability there. Then we are going to Shastika Pindasveda. Shastika Pindasveda is for strengthening. Okay. So strengthening part we are applying this Shastikam in milk decoction. Okay. So herbal Bella powder, that is made a decoction milk is there, you are mixing it both, and that mixed one is used to cook the rice, and that rice is used as potli, and again bala decoction and milk we are taking, and that in that only we are immersing this cooked rice and then applying there. So we are applying it in a low heat way. Okay. We are doing it in local area for recurrent dislocations also. Okay. So in recurrent dislocations, we go through all the techniques, Kiri, Lebanam, and when the inflammation is reduced, the patient will come without inflammation and all. Okay. They will come to you that I have 6 or 5 times my dislocation. Now I can do myself reduction of dislocation. What can you do? Okay, that is the question. Okay. So the thing is, even if there is no inflammation or pain or nothing, we have to go through all these procedures, and then last only you have to stick on to Shashtika Pinda Sveda. First of all, you don't go for the Shashtika Pinda Sveda. That is very important. So you have to assess the condition, the chronicity, and then decide 5 days Rukshakiri, 5 days Potli, that is Hilakiri, 5 days Tailadara. Like that we have to make a protocol. Then last only you stick on to Shashtika Pandaseda. And if there is any wasting of muscle here, you can add mamsa, that is goat meat, you can add along this. You can make it a mamsa Shashtika Pandaseda. So that will increase the ability of the shosha to be better, change over there. So that after doing this is Shashtika Pinda Seda done on the local area only, on the shoulder. The whole body we do that. And also the same thing, without this kiri, we make only the rice, and then we make that paste, just apply the paste. In children, particularly Shashtika Anna Leba treatment is done. We are not making kiri or making heat treatments to children. Children only this cooked rice is made paste and applied all over the body, and a mild massage is done, and for after half an hour it is removed, and then oil, appropriate oil, Shashtika oil, Nalpamara oil, like that is applied on them. So this is the techniques in kiri techniques we are doing. Shashtika is cooler in property, so immediately we have to remove the Shashtika, don't wait for more time. Those are the techniques which we do after the treatment. The total leba is removed. Means this Shashtika Pinda, after doing, the Pinda will be reduced. The rice will be full all over the body. Okay. That rice paste is removed with the coconut leaves. In Kerala, that is very easy to get. So we remove it with or you can use plastic strips of plastic strips you get to remove that. With that you can remove it, and fully you have to remove. The patient cannot remove that. We have to remove the whole body. We have to remove it and apply the oil, and then send them. Then after half an hour they can have warm bath. Okay. Okay. Thank you. Thank you. A good clap for the volunteer. Okay. He is there.
Thank you, Rajesh sir, for this wonderful session.
And also,
still enjoy.
The techniques are there. Very good techniques in taping, shoulder taping, and the exercises we have to do. We have to know it, and which we have to ask them to do. If it is acute, not immediately, but after that. And if it is a chronic one, he will explain more.
Hello. Yeah. So I'm going to teach some shoulder exercises. The first set of exercises will be static exercises, where we are not going to change length of the muscle, but muscle fibers are getting contracted. So there won't be any movement of shoulder joint, but the muscles surrounding the shoulders, that will be used. So first, So first exercise, the player is holding his arms like this. I am putting my hand and I'm asking him to contract the shoulder joint, shoulder muscles, shoulder adductor muscles on my fist. So this way, the patient or the player, he is able to contract his shoulder adductor muscles. The same way, I'm going to ask him to flex, but I'm going to resist him, and he is using his anterior deltoid muscle now. So patient player is trying to flex, and I'm resisting him. So this way, we are able to contract muscle fibers. This will improve blood flow. This will reduce the pain. And in acute condition, we can give these sort of exercises to patient. Okay. And then I'm going to show you some of the dynamic exercises where patient is moving his hand. Yeah, no, that's fine, sir. Yeah. So hold. By tuck. So this is called resistance band. Okay. Now patient is doing. I'm just stabilizing his scapula. Okay. Just shoulder maage ke thoda sa. Shoulder maage. Yes. I'm stabilizing his scapula. Now he's just flexing his shoulder with arm straight. Okay. This is called shoulder flexion. Now sideways. Relax and backwards. The important thing is prescription of the exercises. How many repetitions patient has to do, how many times in a day. So that can be varied according to condition. Okay. So these are basic shoulder exercises. I'll teach you some rotations with the band. Okay. Same way, I am trying to stabilize his scapula so that only shoulder muscles are working right now. And external rotation, okay, and relax. In prescription, sometimes we ask patient to hold the position for a longer period. So that can be used to recruit more muscle fibers, and that helps in reduction of the pain and to increase the strength. Thank you, sir.
After these treatments, we have to ask the patient. We have to make an immobilization of the shoulder joint. For that, we use the bandaging technique. That is a special technique. Means normally, you know, figure of eight technique, figure of eight bandage. That is done with the Muruvanna. We can apply there, and it is left for 3 days like that. Okay, like that itself. So you pour the Muruvanna above this bandage. So first we are making a cotton ball with the gauze and cotton, and it is kept inside the armpit, and then the Muruvanna is applied as a pad on the shoulder, okay, like Piju. We said Piju. So here it is a type of Piju, but it is a bandage is also applied there. So that is applied there.
Cotton outside.
With the gauze outside and cotton inside, we make a pad, and that is applied there.
Before that, you have to
Massaging with the oil application is done, and then this is
the bandage like this. 30 centimeter width. This become 30 centimeter width, and maximum 8 meter. 8-meter length. So just hold on the outer opposite side of the shoulder. Just tell them to hold it, okay? Straight. You can sit straight. Just below the first shoulder, and that ball becomes center of the that.
The cotton ball has not to change. It must be stable there.
You have to tie the opposite chest, not in the axilla region. Here only, that cup here. Don't put in the axillary region.
Because sideways lying will be difficult.
Any difficulty? It's okay. Again, one more you have to round this the same way. Not too tight, not too loose. 2 rounds is enough. Just breathe. How is it too tight? No. Okay. Then kept here like this. Because already the right shoulder is difficulty. So we are putting this in the inside means he can't lay in the both side, only in supine only. That's why we are kept in the anterior side. Then that we have to apply some safety pin to avoid shrinking these cottons. So keep this. One here. And one behind. The same way you can apply. And we have to restrict few movements, so that's why you have to apply ulsangi. Sling, we have to apply the sling. Okay, fine. Okay. This is a method of shoulder bandaging, figure of 8. So we have to remove in hot season within 3 days. In summer season we can keep for 3 days, and cold season we can use up to 4 or 5 days. So again we have to keep maximum 2 weeks. You have to keep this. Then only that will get free movements. When you are applying the Murivanna, that will subside the inflammation also. That's why we are using the Murivanna normally. Okay, thank you.
Sir.
The glenoid labrum injury is also the same way: rest, immobilization, snehasveda, nasyam. That is because the shoulder joint is involved. It is urdhvanga related and the neck condition. So nasyam is recommended in that. And then this nyavara means ashtikapindasveda for 14 days. And in these recurrent conditions or the shoulder joint conditions, the Shastikapindasveda you must do it for 14 days. Minimum 14 days, okay. That is what we are doing. Then Goduma Kiri in this mentioned in glenoid labrum, it is a wheat, okay, wheat as a kiri, we make it as a dhanya kiri and then we can apply that. Then Laksha and Ragi. Laksha and Ragi are calcium rich in content, so that is given in the internally, and Gandhadailam is also given internally. So that we can do as a Rasayana therapy. After these treatments, ask them to take it for 3 months like that. Shoulder stiffness, adhesive capsulitis, Sringam, you see marma manipulations, Lepanam, Dhara, Snehasvedam. You see, we can go on for Dhara, I think so. We can, local. Dhara, how we do it for local areas. The Dhara, it is mentioned in shoulder stiffness, how we are going to do. You can do Dhara on the area where the shoulder stiffness is there. After the Ruksha Kiri, or after the Ruksha Kiri, you can start with Dhanyamla Dhara. So, this is on the knee joint. That we in a shoulder joint we can show.
Shoulder joint.
No, I will explain. Let it be here. Okay. So Dhara is, we have to show it in the shoulder area. Okay. I am showing it in the knee joint. Okay. Sure. It is not a different technique or anything, but for the purpose of to remove the water that I am showing it. You can take it in kindi like this vessel, and then you can apply there. Okay. That you can continuously apply like this. This is a technique. It must be lukewarm, and then you can apply it for half an hour like that. Okay. So that will change. Each day you can increase it like that in like Taila Dhara and all. So you are applying it small vessel, pouring it for longer times like this, and you have an injury here. Here you are doing actually here. Okay. So normally it must flow and we have to collect it like that. Okay. So there is a bicipital tendinitis here, or you have an impingement here, supraspinatus. Okay. You know exactly where the lesion is. You adjust this Dhara. Okay. This Shiro Dhara. You are not doing it on Shiro, means on the head. Okay. You are keeping this Dhanyamla inside this, and you are adjusting this nozzle directly on that. That for half an hour continuously. So you are changing the Dhanyamla here only. You are not doing anything here. The streamline is flowing there continuously. So the Dhara purpose is met particularly to that area. So that is very good in result. Okay. The same way we can move this. The thing you have to check is this must be lukewarm always. So you take reheat it and then again pour it like that. It must be a continuous process. Okay. So I don't want to tell. No, Dhara it is to tell something.
Timing and time duration.
Half an hour we have to do this. Half an hour, 20 to half an hour, not more than that. Okay. Then again, you do the Dhara, just don't leave. You apply Lebana and leave them. Okay. Then again, anti-inflammatory working going on. Okay. So if a treatment is done, Dhara, then don't leave the patient as if. You have to apply the Lebana, you can make a bandage. Like that, if you do for 7 or 5 to 7 days, that will be better. And then you go for Shashtika Pindasveda. Knee joint. Okay. Yeah. A clap from everyone. This is the most sorted treatment. Everybody asks in Marma, any class, what we will do for tennis elbow, what we will do for tennis elbow. There are many techniques for tennis elbow. Okay, but the thing is, the bandaging technique is very important. That is Marma manipulation. We generally do is in the we have to manipulate. We know that it is a external lateral epicondylitis. Okay, so we have to check for the normally here it is tender point lateral epicondyle is tender. So don't ask the go in a hurried way. Do you have pain here like that? The patient will beat because his right hand is okay. Okay. So be cautious. Okay. Don't press immediately. Yeah. Okay. Please.
Right patient of tennis elbow.
So,
yeah. That's it.
So you are not left-hander?
No, I'm
right. So no, we will go. Yeah. No. Suvarna. Normally, if you know Marma manipulation, you can do that. Otherwise, simply you go for bandaging techniques. Okay, that we have shown what to put. Nagaradi leba like that you can apply with the dhanyamla, mix it and then make a paste and bandage it. Okay. And if you know Marma manipulations, you can just palpate, not on that area, just below and above that area to check whether there is a cervical radiculopathy. Here, no that much pain. But normally there is a pain here. That if we point, yes, there is a pain. Okay, that pain, you can strip the muscle there. You can move like this, change the stripping technique is done. Then the same stripping technique, you can keep this elbow on a table on your OPD and you can twist this and then how we'll show that you can, I think. So we are twisting this arm like this to make the muscle tighter there, and then we are stripping the point there, the little oil that Muruvanda. Because you are giving a pressure, you need some oil there, otherwise it will rub the skin like that. A little oil is necessary, just rub it. Then you move the point like this to that tennis area. Okay, that is a slight massage like that. You are stripping it. Okay, you can see that. No, I am not touching there because it is painful. You have to check that. But I am moving just over it only. Till there I am giving pressure. Okay, then removing it. Till that point, then we are removing. Then that muscle area is stripping away the fascia stripping technique like that. Then above this also you have to do the same oil. Because the above area you can see, this area it will be painful because the same way you can do this, the upward stripping, that is painful. You have to release that. Then only you do the bandaging techniques. Okay. And this Ani Varmam, according to Ayurveda, both area it is there, that you have to remove by pressing. You are pressing it both area. Okay. Only bearable pain the patient must have. don't give it a more area. Then there is a rotation, keep it free, okay? Then we are moving a rotation technique, and then this technique we have to do, this small movement. Then this area, this stretching is, spasm is relieved. That is what important. That you have to relieve. Then another technique is, in the same way, in the flow you have to move this extensor, you have to press it and keep it for a while. Means like dough making, you can move it, press it like that. You can teach the patient itself. You can do with the other hand like this, how you just press and push it like that. Like that. Okay. So this muscle is now free little. Okay. So he can move about and not that much pain is there. And Agni Karma is a technique. And normally we do after Lebana only. There is an inflammation there, then reduce the inflammation, then the spot will be exactly elicited. Where the exact pain is there, that we have to elicit, and then we have to apply that area, that point only. So you apply 1 or 2 point on that point, that where the tenderness is there, then below and above 1 more point, you give Agni Karma. So total nerve block is given like that. Okay. Those satellite points are also looked upon. That we have to do. Like that. So he will show the Agni Karma technique. Mahesh Patel. The point is, the tender point, it is the lateral epicondyle area. Yeah. There the Suvarna Shalaga is kept, the point, and the heater, with gentle pressure it is applied.
Now this is silver shalaka with golden tip. And heat is generated and then transferred through silver shalaka till the gold tip. This is the exact point, as we know, it's lateral epicondyle. You have to keep asking your patient. Usually, whenever you have pain there, inflammation there is less burning sensation. Now it is spinning. Okay, and then fine. Kumari Batra. होता है त्रास होता है सर दुखता है कि गरम लगता है हाँ if it is garam लगता है then it's okay, then we will remove it and apply Kumari Patra. Usually we use Kumari
aloe vera,
aloe vera gel. Yeah, keep it applying.
You can apply 2 points up and down also.
Yes. And now, as Rajesh sir has, this is the typical tender point in tennis elbow. First, okay, I'll make it cool again. Okay. And now, from the beginning itself, I'll start. The most important thing is identifying the correct spot, correct point. Okay, yeah. And then start applying heat. So you have little time to ask like how much you feel, whether it is painful, whether there is burning sensation. When pain is more, burning sensation is usually less. So my finger, you can see, like it's touching the shalaka, so that I am also assessing myself, how much hot it has become. That's fine now. Yes, okay. So you can redirect, you can move the golden tip clockwise, anti-clockwise, just to assess the exact area and the direction of the muscle and tendon. That's very, very important. So you are going from the Twak Dagda till Mausa Dagda also. Okay, and now apply aloe vera. gently, gently, gently. Don't rub aloe vera, just apply in a circular fashion. Yes. Now the upper one.
Little more upper. No, upper.
Pain is reduced.
Ah, yeah.
Pain is reduced just now. Yeah.
Right. Okay, fine.
Move.
In Vata Kapasha Avastha, we know we have to identify the Avastha. It should be Vata Kapasha and then Agni Karma should be done. When there is a Pitta Rakta Dushti, we know we have to go for Rakta Mokshana. So we apply Jaloka, we do go for Siraved. Thank you.
We can, in the area, we can apply the cupping also. Cupping with bloodletting techniques, Sringam. Wet cupping you can apply there.
So how do you feel, sir?
Yeah, fine. The pain is reduced. Thank you, sir.
Big round of applause for Devekar sir. That shows his commitments towards Ayurveda. The head of the organizing committee himself got the treatment from Agni Karma.
And taping technique is very important in sports events, because in throw events, the most people complained in that. So 10 minutes.
So this is lateral epicondylitis. So the main function of the muscles is to extend your wrist joint and to extend your fingers. And usually it happens because of overuse injuries in tennis players, in cricket players, the players who are using stick or doing this movement or this movement usually. So when the player has to play next day or the same day, we apply kinesiology tape just to reduce this movement, but the player will be able to perform and play the full event. So this is the lateral epicondyle, okay? And we can start from proximal to the joint, and we can go down. Yeah, this is one. And the second is, yeah, little bit more flexion of the joint. And I'll go above the lateral epicondyle towards flexor part of the arm. Okay? So I think this way your fast bowler will be able to bowl 10 overs in a one-day match. Thank you.
The same way, the decurvanate is the same technique. We can use Lepana, Dhara, Agni Karma in the tendon area. And this taping is also very helpful. And you apply, if you know the taping, if you are bandaging, we do like this, means below the tape there will be Lepana. Okay. We will apply the Lepana and then tape. And for in that purpose, this tape you use only during the event. Okay, I think that is better. This tape we are using it, kineso tape. We are using it in the event time. Okay, and after the event, when the athlete comes back, we will use this adhesive elastic bandage. Okay, but below that there will be a Lebana. We will be apply the Lebana, and then we will put the same elastic bandage like this. If this epicondyle is hurt, then we will we will apply the Lebana there. Then we, with the cotton and all, then the tip part is loosely attached there, loosely sticked on. Then a mild extension is given. Then the end part is loosely attached. So the same taping technique, but after bandaging, means applying the Lebana is done. So both favors the athlete. The same way you can apply the tape in decure venitis. If you are putting Lebana and you can't go in office or any work, then you can put the tape here alone. Bandage, if you are doing bandaging, and then above that tape you can apply that in the same manner. This is a triangular fibrocartilage. The Lepana, Ubanaha and Agnikarma. Agnikarma has to be done in TFCC. It is a very painful condition in that the range of movements, and you have to keep a rest, give rest for I think 3 weeks is very important. 1.5 months is necessary for TFCC. That much problem. But the pain will be reduced immediately after Agnikarma, but rest has to be continuous. Okay, in the lumbar condition, I will show the Abhyanga. Normally, then 5 more minutes. Do you need a bowl? No. The Abhyanga, generally, there are 4 steps. That is, you apply the oil. Okay, you are massaging it. Massage, how to do? Very simple steps. You just apply the oil, the whole body. Okay. This is the effleurage, or we are spreading the oil on the whole body. So this is the way the palms are going up, coming in a parallel way. Again it is going up, but towards more sidewise, parallel way. Then we are going for the fanning technique. Fanning, okay. That is also, we are spreading the oil, okay. So we are doing this. This you can do for 7, 14 strokes. You are giving like this. Okay, that is the effleurage technique. That you are applying oil. Okay. So this way the patient is being prepared for another next part. That is friction. That you have to give pressure with the palms. Okay, you are giving pressure with the palms. You are moving it in the circular rotation. You are giving it. Then you can move it in a harder way. The movement can be like this. You can change. This is a friction technique. So this part has to be given friction. In the same way, the other part has to be given friction. So that you can change the techniques like this. Movement you can give on like that. Like that, we are giving friction technique. Then the kneading technique comes. Kneading technique means you have to plug the skin like this, and the sidewise you are doing like this. The movement that you are taking, pushing, and then releasing. Like that, you have to move on this. The muscle structures are removed. The same way, you have to stand the other part and then do the opposite way like that. So you are moving on that. Then the tapotman comes. Tapotman, you can thudding, tapotman, these things are coming. Okay, pummeling, these things come on in this area. In the muscular area, you can give thudding and the pounding. Okay, only how the patient suffers, that pressure only you have to give. So in Abhyanga, when you massage, you have to give this. And why it is important means, you are not going to massage a whole patient. You are asking the therapist to do or like that. But when you touch a patient for a shoulder condition, okay, neck condition, you have to know these techniques. Or what are you going to do there? Applying oil. So these techniques has to be done locally also. Okay. So on the hand, if you are doing, you are applying oil, the whole area, you are applying the area, then you are giving friction. You can give in according to the patient strength, you have to do that. Then you can do the kneading techniques, then tapotement, these things you can add on to that. So 4 things you have to look on these things. How you apply oil, friction is given, kneading techniques and the thudding techniques, those things. Petrissage, percussion, these things are coming in that. Then vibration techniques are there. You can do like this vibration techniques. That comes in the muscular areas. Okay. You are moving this ringing technique. Ringing techniques are there in the calf muscle area. So this is the primary thing you have to know. And then you have to know which points I have to press more like that. That is the points, marma points or the trigger points which you have to understand where it lies. Then you go for the treatment modalities. Okay, the same way. Any part you are going to touch, you know the treatment modality, how it is to be done. Even if the fingers, you are doing massage and all, you can ask this internal. This is a hand, means a thumb riding like that it is said. So the friction is given with our thumb is used in that. No whole hand is used, but the thumb is used. Each fingers we are giving the massage like that. So that you have to get accustomed to. Where you will practice this? In our own body you practice. Everybody practice ourselves. You have to practice it. You have to practice thumb riding on your hand, the other hand. Like that you do daily. You will have changes. Okay. How you move on the elbow movement and the pummeling, pressing, kneading. Everything you do on your hand, on the thighs, you can do. Oil massage, our own self-abhyanga. With these techniques you study daily. Each technique you do it in each part daily. Okay. Don't be confused. Okay, one technique daily. Okay. So you can be, your hands will be free for doing that. So kai bhagam sei bhagam. In Tamil it is said, when your hands are ready, it is ready to do on others' body also. We must be skillful enough to do these things. So that has to be remembered. Then cupping technique. The cupping you can do to relieve the lumbar conditions. Large cup can be used. Only a mild pressure has to be given. This lumbar area. Then stretching techniques you can use. Okay. Like this, each points you can apply these cupping techniques. In the sciatic condition, on the hamstring conditions and all you can apply. On the here, the gluteal stretches is very important. Lumbar stretch and all. A mild redness is enough, you have to remove the cup. Okay, you can see the redness here. It must not increase as violet coloration or bluish coloration. Before that you can remove. You can do it intermittently for after removing the cup each time. Anybody have shoulder pain? Anybody have shoulder pain?
I'm just showing you some stretches which will help to reduce lower back pain. Okay, so the first is we can go hamstring stretch. We call it 90-90 stretch. So you keep your thigh in 90 degrees. A player or person will hold his thigh at the 90 degrees and will ask the patient or player to take it straight up. So you will feel a stretch on your hamstring. Usually we give 15 seconds to 30-second hold so that the actin myosin complex in muscles that will be stretched properly, okay? And 3 to 5 repetitions in one set, okay? Relax. Then we ask a patient to go for a piriformis stretch, okay? So you will feel a stretch over this part, okay? Same prescription, 15 to 30 seconds hold, okay? Then knee to chest stretch, okay? Then I ask patient to go on prone position, okay? Okay? We ask patient to hold this position for 15 to 30 seconds and according to either pain is on the right side, so I ask patient to go on the left side and hold this position and same with the opposite. Okay, thank you, sir. I just want to add something why I am here, because the Ayurvedic treatments are, we are showing Ayurvedic treatments and why physiotherapist being here. So in my clinic also, we do integrative practice, Ayurveda and physio. So we have seen such a good result with adding these two therapies or practices together. So that's why I'm here today. I'll be showing a small addition to sir's a big or important session. So this is the small addition. It's like a huge partnership is going on. One player is doing 120 runs and I am doing just supporting him with 40 runs. Thank you.
Dravid is the one who is remembered, but okay. We are going, want of time is going on. Just in the knee joint also the same things. Now I think most of the techniques we have shown, what we have to do. You create it into acute and chronic, differentiate it, and where we have to judiciously arrange it. Knee joint is the main thing. We can, bandaging techniques are very important. Up to grade 2 we can use it. Now you can, when you see the protocol, you can feel very easily what have to be done. Okay, most of the things we have done. And this iliotibial band friction, we can ask the patient to lie laterally like that, and if the patient is lying on the left lateral, the right thigh will be coming down. Okay, so you make your elbow flexed, your elbow, our treatment patient's elbow flexed, and then strip it down from up to down. This part has to be used from hip to this lateral area till the knee. Okay, so that you do 3 times. At least the patient must show some pain. They will cry. Don't worry. You do 3 times, then you massage, light massage upwards. Okay, upward massage. Down to up, you have to massage upwards, strip it downwards. Okay, but massaging you have to do upwards. And then you do the Shirodhara technique on the hip area alone for 30 minutes daily. Okay, that will reduce the iliotibial band friction. I think we are stopping the session because most of the techniques we have shown it. Thank you everyone for the patience.
Thank you, sir, for demonstrating all this Karma Sadhana practicals. And I would also want to thank again Dr. Mahesh Patil, Dr. Saurabh Deshmukh, Dr. Nilesh Shirke and team. Without their support, this wouldn't be possible. This looks simple, but it was very difficult to organize all this Karma Sadhana on stage. I would like the audience to be seated for 5 minutes, and we are going to conclude this 2-day-long Sports Ayurveda conference with a valedictory session. This has been very knowledgeable and sharing, contributions, a lot of things we have got to learn. So now a 5-minute break and we'll just be seated in your seats. Only a 2-minute break will be there. Everyone, please be seated. I know you're restless for the tea. Just a few minutes more. I now call upon stage members from the core organizer committee, ex-students of Jnana Prabodhini, members of the medical special purpose group. Dr. Shubhangi Bahirat, she is medical officer, Government of Maharashtra, and Dr. Bhageshri Devkar, she is a pediatrician at Neve Healthcare. For the valedictory function, I hand over the mic to them. Thanks, you've been a wonderful audience.
Good evening, everyone. We are now in the concluding session of this knowledge-enriching conference of 2 days. I would like to take this opportunity to thank you all for your active participation in the National Conference on Sports Ayurveda, organized by Jnana Prabodhini Kridakul, in association with Ayurveda Vyaspeeth and Chandrasekhar Agashe College of Physical Education, Pune, and recognized by Ayush Ministry, Government of India. Without wasting much of time, I would like to start the valedictory session by performing the motivational song of Kridakul. I request Purvatai and Atulatai to start.
जगा
you, Purvatai and Atulatai. I request Dr. Shubhangi Bahirat to introduce and felicitate our dignitaries on the dais.
Thank you, Dr. Bageshri. Welcome everyone in this evening session and a concluding session. We are very much honored to have such distinguished dignitaries among us and for this session. And I take this opportunity to introduce and felicitate our honorable guests. Firstly, I'd like to introduce Dr. Girish Bapat. We all know Girish Bapat as the director of Jnana Prabodhini, but he's has a doctorate degree in organic chemistry from University of Victoria, Canada. He also holds master's degree in education and a postgraduate diploma in business management. Himself an alumnus of Jnana Prabodhini, a school for intellectually gifted children. He also worked as principal of the school for 5 years. Jnana Prabodhini works in the field of education, rural development, health, social organizations, research, and also national integration. As director, Dr. Bapat supervises and guides the activities in all these fields. Dr. Bapat is also the chairman of Mensa India, which is provisional national chapter of Mensa International. Dr. Bapat has developed group tasks for high school students, college students, and adults and used these to train participants in teamwork. He has traveled to different parts of India to organize relief works and youth camps. He has conducted workshops for teachers and principals of school and colleges on various topics like project methodology, action research, training for development of behavioral intelligence, process orientation education, futurology and formative evaluation techniques. He has also written several articles in Marathi as well as English on the importance of attitude formation and motivation building for personality development. So I want you to give a round of applause to Dr. Girish Bapat. Today we are honored to have Mr. Suhas Patil as our honorable guest. He has been inducted in Sports Department of Government of Maharashtra through MPSC. He is the Deputy Director of Sports for Government of Maharashtra. He is the Principal of Krida Prabodhini, Balewadi. He has been instrumental in pursuing reservations for sports persons in government employment. So you can know what important role he is playing for those who are in sports. So a big round of applause for Suhas Patil, sir. We also have among our dignitaries Vaidya Dhananjay Vasant Kulkarni. He is an experienced Ayurvedic consultant with more than 27 years of professional practice. He has specialized in the field of oncology for over 23 years. He has skills in professional Ayurvedic practices, panchakarma, teaching, research, leadership, and team management. He runs Bharadwaj Clinic, Ayurvedic clinic with Panchakarma facility at Pune and works as an Ayurvedic consultant at cancer OPD in various hospitals. He has also worked as a teacher and lecturer for different diploma courses and as research guide for various research projects. He has been associated with several organizations in field of Ayurveda and worked as a treasurer, executive committee member, and secretary in the past. So I would request, we also have among our dignitaries, Mr. Mahesh Deshpande, who is the professor in Chandrasekhar Agashe College of Physical Education. I would request Dr. Girish Bapat to felicitate our honorable guest, Mr. Suhas Patil. Girish. Next, I would request Dr. Girish Bapat to felicitate Mr. Dhananjay Kulkarni, Vaidya Dhananjay Kulkarni. I would request Vaidya Dhananjay Kulkarni to felicitate Dr. Girish Bapat. We are blessed to have such dignitaries among us, and these are great people, so it's better that they felicitate each other. Thank you very much, sir. We also take this opportunity to felicitate our core committee members. Will all the core committee members sitting behind stand up? I'd like to introduce Saurabh Deshmukh, Dr. Saurabh Deshmukh, Nikhil Sonone, Dr. Parag Patil, Vaidya Amrita Deshmukh, Vaidya Medhatai Devrekar, Vaidya Diptitai Dharmadhikari, Vaidya Amrish Dedge, Vaidya Mahesh Patil, Vaidya Nilesh Shirke. Thank you very much. There are also some dignitaries among our audience. I would like to call forth Dr. Anand Lunkad. He has been a coach in Kridakul. He was a Kho-Kho coach. He has also completed his doctorate. I would like Dr. Girish Bapat to felicitate Dr. Anand Lunkad. We are very honorable. We have Honorable Vaidya Karandikar Madam, diving champion, the first woman, Karadkar Madam. She is the first woman diving champion and a Shiva Chhatrapati awardee. A huge round of applause. I request Dr. Girish Bapat to felicitate Karadkar Madam. We also have among us Ayurveda practitioner Vaidya Uday Joshi. Vaidya Uday Joshi. I would request Dhananjay Kulkarni sir to felicitate Vaidya Uday Joshi. I would request Vilas Jadhav sir to come forward. Vilas Jadhav. He is a member of Ayurveda Vyasapith. I would request Vaidya Dhananjay Kulkarni to felicitate Mr. Vilas Jadhav sir. We also have among us Dr. Sagar Deshpande, Chief Editor of the magazine Zadan Ghadan. Recently, he has also authored a book on Dr. Raghunath Mashelkar. So, I would request Dr. Girish Bapat to felicitate Dr. Sagar Deshpande. He is also a supporter and a mentor of Jnanaprabodhini Pune. Thank you very much, sir. I'm also pleased to announce that Smita Deshpande is among us. She is an ex-student of Jnanaprabodhini Nigdi. She is also a writer and she has recently authored a book, Antidote, which is a fiction based on the pandemic. So some of you must have read it. It is a thriller too. I'd request Dr. Girish Bapat to felicitate Smita Kulkarni. Smita Deshpande. She was Kulkarni first. We also have among us Vaidya Sachin Sarpotdar. Vaidya Sachin Sarpotdar. He's BAMS and MSc in Health Sciences. He's a lecturer at MEMS Savitribai Shah Ayurvedic College, Hadapsar. He has done some great work in research methodology and medical statistics in Ayurveda. He was in charge of today's paper presentation. He has also worked for propagation of Ayurveda in Spain, Germany, and also in USA. I would request Vaidya Dhananjay Kulkarni to felicitate Vaidya Sachin Sarpotdar. We also have among us Vaidya Yogita Zamdade. Vaidya Yogita Zamdade. She is professor and HOD, Department Ayurved Saumita Siddhanta, College of Ayurveda and Research Center, Nigdi, Pune. She is a consultant in Twacha Rog OPD at Ayurved Rugnalaya and Sterling Multispeciality Hospital, Nigdi, Pune. I would request Girish Bapat sir to felicitate Vaidya Yogita Zamdade. Thank you very much. I'd like to hand over the next part of the session to Vaidya Dipti Dharmadhikari. Thank you very much.
Since yesterday, we are exploring a new horizon of sports Ayurveda. This conference based on themes of selection of athletes, fitness of athletes, enhancement and injury management of athlete. As all of us know, beginning with a grand opening ceremony in the presence of Rahi Saurnobat, an Olympic player, Dr. Shriram Savrikar, ex-Ayush advisor, Dr. Sanjeev Sonone, Vice Chancellor of Savitribai Phule Pune University, Vaidya Vinay Velankar, founder member of Ayurved Vyaspeeth, Sopan Kangne sir from Agashe College, Subhash Rao Deshpande from Jnanaprabodhini Institute, Sriranga Barane and Amar Sabale, MLA of PCMC. In this ceremony, Rahi emphasizes need of biochemical trials of Ayurvedic medicine to prove its effects on athlete, whereas Dr. Sanjeev Sonone praised organizer being a pioneer of sports Ayurveda conference. Dr. Shriram Savrikar appeals to inclusion of Ayurveda in sports and to avoid over-commercialization of Ayurveda. Sriranga Barane also emphasizes on contribution of Jnanaprabodhini in sports development. First session is a lecture of Vaidya Vinay Velankar sir. He emphasizes on contribution of Ayurveda in athletes. Next session is a presentation session of Kridakul, in which selection of athlete and game selection procedure is explained by Kridakul Vaidyas. Vaidya Shri Prasad Bavdekar conclude this session with his futuristic canvas of sports Ayurveda. He emphasizes on vertical and horizontal axis of development of sports Ayurveda with his experience sharing. He appeals Kridakul to develop as a holistic sports Ayurvedic center including research, academics, and specialized therapeutic aspect for sports person. Dr. Kaustubh Radkar suggests to research on fitness enhancement and ensure us to support to propagate sports Ayurveda concept. In fitness panel discussion, Vaidya Mangesh Deshpande discussed a brief role of Ayurveda in injury management. Vaidya Sharvari Inamdar briefly elaborate her experience in strength development of athlete. World champion Mariam emphasizes on detoxification of body and effect of it on endurance training. Vaidya Mahesh Patil and Dr. Mahesh Deshpande conducted this discussion very nicely. Chairperson of this session is a polar marathon runner, Dr. Utkranta Kurlekar, shared his experience and state the scope of Ayurveda in such strenuous event. Diet for athlete is briefly explained by Vaidya Urmila Pitkar on philosophical background and Granthokta recipes of Ayurveda for sports nutrition. Diet and supplements for athlete is a next panel discussion. In this session, Vaidya Prakash Thomre, a marathon runner, explained own experience of use of Ayurvedic nutrition for his own performance. Vaidya Urmila Pitkar share performance booster recipes from Granthas and from practical approach. Mariam share her experience of hydration with sea water and no use of supplement in achieving world championship of titles. Dr. Tejas elaborated role of modern sports nutrition in performance of sports athlete. Vaidya Amruta and Vaidya Nilesh Shirke nicely conducted this session and concluded role of integrative practice of sports nutrition. This day ends with grand and breathtaking sports demo. Sanchalak in this session, Sanchalak gives importance of sports in social development and keep it doing and growing it to enhance future success of Kridakul in upcoming international and Olympic Games. Second day started with acute and chronic injury management through Ayurveda by Rushitulya Vaidya Shri Trilok Dhopeshwarkar sir. Chairperson Dr. Milind Modak emphasizes on paradigm shift towards use of alternative medicine and praised sports Ayurveda. Dr. Rajesh S. presented working model of sports Ayurveda research cell in Kerala with his experience in Commonwealth Game 2010. Chairperson Dr. Dhananjay Kulkarni stated practical applicability of Granthokta preparation in development of sports enhancement and injury management. The another session is an innovative research paper and poster presentation based on sports Ayurveda theme. Vaidya Sachin Sarpodda sir and Vaidya Yogita Zamdade madam coordinate this session very nicely. A nice interaction with athlete where they shared their first-hand experience in Kridakul and how Ayurveda helped them to achieve success and lifestyle management is the another discussions. Last session is an eye-opener session of practical demonstration of integrated approach of Ayurveda procedures and physiotherapy in sports medicine field. Fitness enhancement and persiveness are keys of success. We assure that in future, we always try to achieve next level in exploring sports Ayurveda. Thank you.
Thank you, Dipsitai, for concising the whole 2 days sessions. It was definitely a very, both the days were very knowledge enriching. I'm sure you must have enjoyed the demonstrations as well, which were performed yesterday in the evening. We hope that the conference has provided you with new insights, which will help you in your future endeavors as well. We would like to hear some experiences from the delegates which have come here. May I call upon Dr. Spurti Akkarbote to share her experience of 2 days conference.
Good evening, everyone. To make an excellent film, director, producer, and actor all these three parts play important role. In the same way, for our National Conference of Sports Ayurveda, Jnana Prabodhini's Kridakul is a producer, in fact, is a factory of dynamic sports person from last 25 years, with a good data keeping also. Since yesterday, some of them are with us. Ayurveda is a director of this film. Basic need of sportsman is to improve performance with maintaining good quality of health during and in recovering phase of game. Here, Ayurveda comes forward with its different ways of instant pain management and for long-term panchakarma, rasayan chikitsa, lifestyle management with dinacharya, rutucharya, and diet. With all these, Ayurveda will help to give spectacular results to our heroes, our actors, our ground players, in the form of national, international players and coaches. For Ayurveda, it's an era of specialty practice. Application of Ayurveda and yoga in sports is a revolutionary and noble thought. Let's cultivate and nourish it together. Thank you. Thank you for organizing committee for giving me chance.
I now call upon Dr. Yogesh Jain, Ayurveda Charya, to talk few words about the conference.
सम्माननीय मंच और पधारे हुए सारे डेलीगेट्स को शिव जयंती की हार्दिक शुभकामनाएं प्रेषित करता हूं। आयुर्वेदा इन स्पोर्ट्स, ये संकल्पना बहुत वर्ष पहले मेरे दिमाग में चल रही थी, पर उसका मूर्त स्वरूप ज्ञान प्रबोधिनी ने यहाँ प्रकट किया और उसमें सहभाग होने का मुझे मौका मिला। मैं अपने आप को बहुत खुशनसीब समझता हूँ और आप भी अपने आप को इस प्रकार समझ रहे होंगे कि हमको एक नया ओपनिंग मिला है और जो हमारी कल्चर को, हमारे विज्ञान को, संस्कृति को आगे बढ़ाने का मौका हमें मोदी जी ने प्रदान किया है, जिनके छत्र छाया में ये सारे पुष्पित और पल्लवित हो रहे हैं। एक बार मैं चाहता हूं कि आप सब लोग उनके लिए जोरदार तालियां बजाएं, क्योंकि बिना उनके आधार के, बिना उनके सहयोग के, उनके प्रेरणा के इतनी सारी बातें जो पिछले 8-10 सालों में घटित हो रही हैं, संभव नहीं था। और मैं पुण्यशाली समझता हूँ अपने आप को कि मैं इस कड़ी से जुड़ रहा हूँ और अपने आप को इसमें आगे और बढ़ाने की कोशिश कर रहा हूँ। मैं अनेक वर्षों से स्पोर्ट्स में जुड़ा हुआ हूँ। मेरा लड़का क्रिकेट खेलता है और उसके साथ में मैं भी ग्राउंड पे, आप बोलते हैं प्रकृति परीक्षण सिर्फ इसका नहीं होना चाहिए प्लेयर का, पर उसके गेम्स का भी होना चाहिए। तो उसमें गेम्स में क्या क्या स्थितियाँ होती है, कैसी स्थितियाँ बन सकती है, कहाँ उसको बचाना है, उसका लाइफस्टाइल कैसे रखना है, ये सारी बातें मैं टैकल कर रहा हूँ। बट यहाँ जो ओपनिंग हुआ है वो एक्सेलेंट था और कल पिटकर मैडम ने बताया था कि सिर्फ खाने से ताकत नहीं मिलती है, पचाने से ताकत मिलती है। तो ये बहुत बड़ा मैसेज है उन लोगों के लिए जो बहुत ही ज़्यादा सप्लीमेंट्स, प्रोटीन, नंबर ऑफ़ थिंग्स ऐड करते हैं बिना ये देखे कि वो पचा रहा है कि नहीं, और उसके साइड इफ़ेक्ट इतने सारे हो जाते हैं। तो हमें एक मैसेज क्लियर करना है कि हमें इतना ही खाना है जो जितना पचा सकते हो। पचाने की क्षमता बढ़ाओ, खाने की क्षमता अपने आप बढ़ जाएगी और वो लगेगा, बॉडी को एक्सेप्टेंस रहेगा उस सारी बातों का। तो एक अच्छा टेक अवे है यहाँ से, हमको ले जाना है कि बेसिक समझना है। सारे गेम्स के लिए बेसिक ही इम्पोर्टेंट है, क्रिकेट के लिए भी बेसिक समझ लो, आप उसमें फ्लरिश कर सकते हो। ये सारी जो मैनेजमेंट है इसमें बेसिक वही है, लाइफस्टाइल, आहार, निद्रा, ब्रह्मचर्य, ये सारी बातें जो न्यू ओपनिंग्स हैं। बहुत सारे ऐसे यहाँ पे अटेंडेंट्स हैं जो अपना करियर शुरू करने वाले हैं। तो मैं समझता हूँ कि आपको एक अच्छा करियर लाइन मिल रहा है यहाँ पे कि आप स्पोर्ट्स में काम करें। मुझे मौका दिया ज्ञान प्रबोधिनी का बहुत बहुत एक बार मेरी ओर से शुभकामनाएं देता हूँ। 25 वर्ष आप जो काम कर रहे हो, आगे आप ऐसे सुवर्ण जयंती और भी मनाएं और हमको बुलाएं, ठीक है? धन्यवाद।
We would like you also to be a part of this journey, sir. Thank you so much, Dr. Spurti and Dr. Yogesh Jain. Now, I would request our chief guest, Dr. Deputy Director Suhas Patil, to give us some message.
खेळ आणि आयुर्वेद याच्या राष्ट्रीय कार्यशाळेच्या निमित्तानं उपस्थित मंचावरील सर्व सन्माननीय मान्यवर, आज खरंच ज्ञान प्रबोधिनी अनेक आम्ही वेगवेगळ्या प्रशासकीय कामकाजाच्या याच्यानुसार आम्ही शैक्षणिक संकुलं बघतो. शैक्षणिक संकुलामध्ये वेगवेगळी प्रगतशील अभ्यासक्रम करतात, परंतु खेळ हा या समाजाचा एक महत्त्वाचा घटक आहे आणि तो देशाला आणि राज्याला अनेक ठिकाणी स्वाभिमान मिळवून देतो. म्हणून केंद्रभूत असं काम त्या प्रगतीसाठी केलं पाहिजे अशी आशा आणि अपेक्षा ठेवून सातत्यपूर्ण काम करणारं एक वेगळं संकुल म्हणून नक्कीच ज्ञान प्रबोधिनीचा आम्हाला अत्यंत स्वाभिमान आहे. आणि प्रामुख्यानं हे कधी घडतं की त्यामध्ये आवड असणारी लोक कायम सातत्यपूर्ण रुची घेऊन टिकून आपल्या मनोधारणेनं सहकार्याला समोर घेऊन आपल्या प्रशासनाला व्यवस्थापनाला वेगळा आत्मविश्वास देऊन जेव्हा ह्या गोष्टी कळतात तेव्हाच अशा राष्ट्रीय परिषद ज्ञान प्रबोधिनीमध्ये घडू शकतात. आणि म्हणून देवळेकर सर, तुम्ही आणि तुमचे सहकारी नक्कीच एक वेगळी दिशा या क्रीडा क्षेत्रासाठी आयुर्वेदाच्या माध्यमातून आपण प्रगती साधू शकतो. आणि म्हणून अशी कार्यशाळा आपण लक्ष वेधलेलं आहे. हा सगळ्याला आणि आपल्या कौतुकाचं नक्कीच आम्ही इथं आपल्याला अभिनंदन करतो. आणि म्हणून आपल्याला माहीत आहे की अनेक खेळामध्ये हिरो येतात, अनेक तारे येतात आणि चमकले की तुम्ही आम्ही सगळे लक्ष वेधतो, कौतुक करतो, बक्षिसाचा वर्षाव करतो. परंतु त्याच्या पाठीमागे एक मोठं असं एक पाठबळ असतं. प्रामुख्याने त्याच्या आईबाबांचं पाठबळ असतं. एक अज्ञानी मुलगा असतो आणि लहान वयामध्ये त्या क्रीडांगणाच्या व्यासपीठावर जावं असं त्या मातेला वाटतं, असं त्या पालकाला वाटतं. आणखी तो अज्ञानी मुलगा गुरुपीठावर बसलेल्या एका माणसाच्या हातात देतो आणि त्याचं श्रम, अफाट श्रम, आमच्या खेळामध्ये अफाट श्रम आणि मेहनत ह्याच्यावरच आमचं क्षेत्र सगळं व्यासपीठ आपलं अवलंबून आहे. आणि मग त्या गुरुच्या याच्यावर विश्वास ठेवून आम्ही प्रगती करतो. आणि म्हणून गुरु जेवढा ज्ञानी तेमचं आमचं क्षेत्र ज्ञानी. आणि म्हणून गुरुमध्ये सातत्यपूर्ण जिज्ञासूपणा, शिकण्याची वृत्ती ही असली पाहिजे. आणि म्हणून अशा कार्यशाळेमध्ये त्या गुरुची पण उपस्थिती, त्याला सहकार्य करणाऱ्यांच्या सर्व मनुष्यबळाची उपस्थिती ही आपल्याला महत्त्वाची आहे. आणि मग आम्ही अनेक बालेवाडीमध्ये मी उपसंचालक आहे, अनेक राष्ट्रीय आंतरराष्ट्रीय खेळाडू बघतो. तो खेळाडू जेव्हा जिंकतो त्याच्या पाठीमागं मोठ्या टीमचा विजय असतो. म्हणजे गतीनं 100 मीटरामध्ये ह्याच्या धावण्यामध्ये त्याला लागणारे जे 12 सेकंद असतात त्या 12 वर्षाचं तप त्याच्या पाठीमागं असतं. आणि म्हणून ते टीमवर्क असल्याशिवाय हे खेळामधला विजय साध्य करणं शक्य नाही. आणि मग खेळामध्ये जर गुंतवणूक जर म्हटलं तर एका मातेचं भाकरी भाजण्याचं पासून कुटुंबाचा ज्ञानार्जनाचं किंवा त्याच्यामध्ये आर्थिक संचय असतो. तो गरीबातला गरीब कुटुंब, माझा मुलगा खेळामध्ये जर चांगल्या रीतीनं मेहनत करणारा असेल, त्याच्याकडं शरीर संपदा असेल, कौशल्यपूर्णता असेल, तर आई बाबा पोटाला चटके मारून त्या पोरग्याला ते व्यासपीठ मिळवून देतात. आणि आमचा प्रगतीचा काळ किती आहे? 5 ते 7 वर्षाचा. म्हणजे 365 दिवसातले आम्ही सकाळचे 2 तास, संध्याकाळचे 2-3 तास मेहनत करतो. आणि म्हणून आमच्या कपॅसिटी बिल्डिंगवर साधारण एक 3-4 हजार तासांचं गुंतवणूक होते. आणि तेवढ्या श्रमामध्ये मला जगज्जेता व्हायचं आहे, मला राष्ट्रीय विजेता व्हायचं आहे, मला कौशल्यपूर्ण खेळाडू व्हायचं आहे. आणि म्हणून अशा रीतीनं टीमचा संचय आहे तो अत्यंत केंद्रभूत आणखी काम करणारा आणि अभ्यासू असावा लागतो. आणि म्हणून अशा कार्यशाळेमधनं आपलं जे ज्यांच्या व्यक्तींना ज्ञान मिळतं ते नक्कीच खेळाडूपर्यंत पोचवण्यासाठी मदत होणार आहे. आपली ही कार्यशाळा भविष्यामध्ये अधिक खालती जाऊन आपल्या खेळाडूंपर्यंत अशा रीतीनं प्रॅक्टिकलपर्यंत त्याच्यामध्ये कसं जाईल असं आपण पाहूया. शासन म्हणून आमच्याकडं माझ्याकडं 400 विद्यार्थ्यांचं व्यवस्थापन आहे. त्या ठिकाणी तुमच्यामध्ये इथं शिकलेल्या लोकांना काही प्रयोगशीलता करायची असेल तर अशा प्रॅक्टिकलमध्ये आपण हे करू. जिथं ग्राउंडवर काही सेशन घ्यायचे असतील अभ्यासाला कोणाला तरी वाव द्यायला पाहिजे, त्याला खेळाडू अनुभवायला द्यायला पाहिजेत. त्याशिवाय इथल्या ज्ञानाची त्या प्रॅक्टिकली त्या खेळाडूपर्यंत जाण्यासाठी मदत होणार नाही. आणि म्हणून शासनाच्या वतीनं जे जे आपल्याला सहकार्य करायचं आहे, कृतीबद्ध सहकार्य करायचं आहे, नक्कीच आम्ही पुढे येऊ. आपल्या याच्यामध्ये मला बोलावलं त्याबद्दल आम्ही धन्यवाद मानतो. जय हिंद, जय महाराष्ट्र.
Thank you so much, sir, for your kind words. We will definitely take this opportunity, and people would definitely like to come to your institute and do some research over the students. Now I request Vaidya Dhananjay Kulkarni sir to say a few words about the conference.
It is not expected that I should say something, because whatever was expected, I talked in the morning. So again, I am thankful to Nyan Prabodhini for inviting me here for this post. Thank you, thank you.
Thank you so much, sir. Now, since many of you must are waiting for the prize distribution of papers and posters, basically, we were not very sure whether we will get so many papers for all these subjects, because this is a very new subject to everyone and very few people must be working over it. So we were really happy to have 27 papers and 10 posters which were presented today. I now call upon Vaidya Yogita Jamdade to take this process of felicitation of the students.
Thank you, Dr. Bageshri. Without taking much time, I would like to call upon Dr. Sachin Sarpotdas sir to announce the winners of poster session and paper session. Dr. Sachin Sarpotdas sir. Yeah. Dr. Bageshri has already mentioned that we have received 27 papers and 10 posters. And out of these posters and papers, we have selected the best one. We have received many papers at 11th hour also, but we denied that papers, sorry, because we are having stipulated time to present that. And for presenting this paper, we have chairperson and co-chairperson, Dr. Meenal Lad, Dr. Saroj Patil, Dr. Ila Bhor, and Dr. Prayag Setia, along with Mr. Prabhu and Bijutkar madam and some dignitaries from Agashe College evaluated these papers. And Dr. Amrish sir evaluated posters. And now, Dr. Sachin Sarpotdas sir tell you in detail the process of evaluation. Thank you very much.
Thank you. Hello. Thank you, organizing committee, for giving me this opportunity. As per the request of the organizing committee, I have to say few words about the summary of the research papers, what we received actually, and then I will declare the names. First of all, majority of the papers which we received were from the conceptual and review articles. It was expected for us because it is the first time we are organizing a conference on this topic. Then we got a paper on clinical trial, very few paper. So out of that, we selected one. Then we received case study, that is also one. And on management and injury, we received the paper 12. Diet and nutrition, we received 4 papers. And Ayurveda for athletes, 7 papers, and Ayurveda and sports, 6. And besides that, we also received some posters. I know that this time we are focusing on concepts and review article, but I am sure in future the hypothesis will be developed, because the goal of this conference is to sensitize the people about the research activity and to motivate them to publish their views, publish their opinion, and publish their experiences through the research papers. That was the motivation. And we conducted this research paper presentation in 4 different halls. So the winner of the Prithvi Hall, that is Ayurveda and Sport Medicine, a systematic review, and the prize goes to Dr. Divyashri K.S. from CARC. I would like to request Suhas Patil sir to felicitate Dr. Divyashri K.S. The best paper from AAP research department or research hall goes to an Ayurvedic daily regimen, that is Dinacharya, for athletes, a review paper, and this goes to Dr. Karina Dalvi. Ravina Dalvi, excuse me. Ravina Dalvi. It is a handwriting of one of the doctors, so very difficult to read doctors. I would like to request Dr. Patil sir to felicitate Dr. Ravina Dalvi. The best paper from Teja Research Hall goes to role of medicated thandai for wrestlers. And I would like to request Girish Bapat sir to felicitate Dr. Sanika Khokles. She is a future doctor. Then the best paper from Vayu Research Hall goes to Management of Sports Injury through Ayurveda. And I request Girish Bapat sir to felicitate Dr. Kiran Mendekar madam. Dr. Kiran Mendekar madam. Then there were 2 halls for poster presentation, and the prize goes from one hall, that is Integrated Ayurvedic and Physiotherapy Management of Lateral Ankle Sprain with special reference to acute sport injury, Dr. Harishankar. The prize goes to Dr. Harishankar. May I request Dr. Patil sir to felicitate Dr. Harishankar. From the second poster presentation hall, the prize goes to Ayurveda in Athletes Developing Physical and Mental Strength, Vaidya Apurva Mundargi. Vaidya Apurva Mundargi. May I request Dr. Dhananjay Kulkarni sir to felicitate Dr. Apurva. And I am very much thankful for all the presenters. Actually, those who have not received the prize at this time, be sure next time you will receive the prize. Thank you.
Yeah, I would like to thank the coordinators of the hall. They have also worked well. Dr. Shilpa Swar, Dr. Aarti Patil, Dr. Dipti Dharmai, and Dr. Almaz Sheikh. They have coordinated these sessions. Please give them. Thank you very much.
Thank you, Sachin sir. Thank you, Yogita ma'am. Now I request Vaidya Medha Devekar ma'am to present the declaration to the Ayush Ministry.
On this occasion of the Sports Ayurveda Conference, I, on behalf of Kridakul, take the opportunity to make a few declarations which can be implemented by the government policy makers regarding the role of Ayurveda in sports. We at Jnana Prabodhini Kridakul, Pune, in association with Ayurveda Vyaspeeth and Agashe College of Physical Education, had organized a national conference on sports Ayurveda in the premises of Jnana Prabodhini. The conference was attended by Ayurveda students, Ayurveda practitioners, academicians, researchers, national and international sportspersons, coaches, physiotherapists, modern medicine doctors, and various sports enthusiasts, and sports industry stakeholders, and also invited media officials. On behalf of Ayurveda community, we have proactively passed a few resolutions and request you to consider implementing them throughout Pan-India. Ayurveda, the system of medicine practiced in India for thousands of years, has proven to be effective in promoting physical, mental, spiritual health. It offers a holistic approach to the health and wellness, which particularly is relevant in the context of current sports science. Therefore, an awareness camp should be run in all government-run sports organizations about the benefits of Ayurveda, especially in the domain of health of athletes. Ayurveda has proven effective in enhancing sports fitness components, preventing overuse of sports injuries, treating sports injuries, and fulfilling sports diet and nutrition requirement. It helps the general well-being and psychosomatic health of sportsperson. All the central and all the state governments may fund projects to facilitate research programs to validate the above observations. The role of Ayurveda in the field of sports may be included in the curriculum syllabus of basic secondary schools, which will describe the benefits of Ayurveda lifestyle and diet recommendations for physical fitness. Every university may start basic and advanced courses that will have a sports Ayurveda curriculum. Every state government may start sports Ayurveda department, just like the Kerala government, the model of the Kerala government, which is being carried out since the last 14 years, and promote Ayurveda at all district level sports organizations. Each district may have government-run sports clinics, which will facilitate all state players for treatment, which may be free of cost. Sports Ayurveda clinics at primary health centers and rural hospitals may be run to save rural raw athletic talent getting spoiled due to overall sports injuries. To tap and groom rural sports talent, state government may take actions accordingly. Jnana Prabodhini Kridakul has successfully completed its silver jubilee year and carved a niche for itself. Its unique sports school has been following the Catch Them Young principle and successfully produced many state and national level athletes by following and utilizing Ayurveda for the budding athletes. Every district should have such sports school based on the theme and principles of Kridakul. At Jnana Prabodhini Kridakul, we have developed Ayurveda protocols for young athletes. These training and fitness protocols have aided the inmates of Kridakul in their personal and professional lives, while also improving the overall health in a holistic manner. We would be delighted to share and provide you with this information, which will benefit young athletes across the country. We strongly believe that following Ayurveda principle by athletes will definitely help in bringing India on the top in the medal chart. Thank you.
We all agree with the declarations. Can you may raise your hand? Yeah, everybody. It's on behalf of we all us. Yeah. Okay, thank you.
Thank you, Midhatai. May all our wishes come true. And before going ahead, I would like to thank all the Kridakul staff and all the Sevak, all the administrative staff who has been working so long over past many days. Last 1 week, they have worked very hard. So let's have a big round of applause for them. Now let's come to the valedictory speech. May I request Honorable Dr. Girish Bapat sir to give us the message at the end of the conference.
I am a bit confused at the moment whether I should speak as the director of the host institution or the guest of the valedictory function. Because this is the concluding session of this conference, I would have liked to take review of what Jnana Prabodhini wanted when the Kridakul was started and when the idea of this conference came to our mind, and how far we have gone in that direction and what else is remaining. As the chief speaker of the valedictory function, it is expected that I should talk about what are the future directions for this multidisciplinary subject of sports Ayurveda. Jnana Prabodhini has a twin motto. In science and technology, we have to keep up with the latest and modern. And in culture and spirituality, we have to work for continuation of our tradition. Now, Ayurveda is a science and also a part of our culture and tradition. Its application to sports seems to be new, but if you start going into history, you will find that there have been many Vaidyas in the past also who have helped sports person or those who are enthusiastic in physical culture. This is the third national conference being arranged by Jnana Prabodhini. The first one was in 1988. It was on the topic of IQ controversy, and there was a paper on Ayurveda in that conference. Then the second national conference was on giftedness, beyond IQ. And there also there was a paper on Ayurveda. This conference was solely devoted to Ayurveda. Another coincidence I have found is that in that conference, in the first conference, there was someone from Pondicherry who talked about what is being done in the Sri Aurobindo Ashram. In the second conference also, there was someone from Pondicherry who talked about what is being done in Ayurveda, Aurobindo Ashram. I came to know from Sri Devulekar that there is one representative from Pondicherry. I don't know whether he's from Aurobindo Ashram, but I would like to point out one thing. The Pro Vice Chancellor who was present yesterday, he appreciated the volume of original data of sports persons kept in Kridakul. what is the importance of this data and how to keep this data, Shri Devulekar and Dr. Anand Lunkar, they had gone to Pondicherry, and there they got to know what is the importance of all these physical measurements, even for yoga sadhaks in the ashram. Then it is necessary, very much important for sports person. Ayurveda and sports, Kridakul has the motto of developing Olympic medal winners. That is a tangible target, so everyone likes to work for what is tangible. But beyond the tangible, there have to be some intangible objectives also, which give us direction to all our work. Ayurveda and sports, can they be used, should they be used for positive health or wellness as it is called now? I think it should be done. Whether it should be done in Kridakul, I think it should be done in Kridakul also. And the practice being followed in Kridakul has to percolate in all other departments of this Nigdi complex and all the schools in Nigdi also. And this is a national conference. There are delegates from many states. I think this practice should go to schools all over India, and that is a part of the recommendation which Vaidya Medha Devulekar talked about. Should Ayurveda and sports be used for personality development? I think it should be used for that. I, for myself, from personal experience, know that sports can be used and should be used for sports physical personality development. And I have been using it for several years. Not being an Ayurvedic practitioner, I don't know whether Ayurveda can be used, but some of my friends say that in the traditional literature referred to by Ayurvedic practitioners, there are many indications that it can be used for personality development also. And I think sports and Ayurveda both in tandem could be still better used for that. The next important part, can Ayurveda and sports be used for social transformation? If the whole population is oriented toward healthy habits, healthy living, I think there will be social transformation also. And the song which has been sung during all the sessions, the end of that is Balanecha Ho Dharma Samsthapana. That Dharma Samsthapana is social transformation. And I think sports and Ayurveda both should be used for social transformation also. Now, whether the coaches on the play field be able to do all this, some coaches have done that. So it can be an objective for the coaches on the play field also. Those sports psychologists and sports medical practitioners, they can also do this. But as Shri Suhas Patil, Deputy Director, just now said, that nowadays everything is team effort. Mr. Sagar Deshpande, Dr. Sagar Deshpande is here. He has recently written a biography of Dr. Mashelkar. Dr. Mashelkar being president of Jnana Prabodhini, I read the whole biography as soon as possible. There, he has mentioned 10 major scientific achievements in India. They have been mentioned by Dr. Jayant Naralkar, and Dr. Mashelkar is involved in one of the achievements, so it has come in the biography. Dr. Jayant Naralkar has said that the pre-independence scientific achievements in India were all individual achievements. Work done by individual scientists. They were great scientists. C.V. Raman is mentioned in that. Ramanujan is mentioned in that. Jagdish Chandra Bose is mentioned in that. But they were individual scientists, great scientists, but their achievements were individual achievements. And the 5 scientific achievements post-independence, they are all achievements made by big teams. The Green Revolution is mentioned in that, the White Revolution is mentioned in that. And the last one is the transformation of CSIR done by Dr. Marshalkar and the team of all the national laboratories. So this has become a major change in the development activities in all countries. This happened during the Second World War. Pre-Second World War, most of the discoveries and inventions were made by individuals. During the Second World War, the urgency was such that discoveries could not be dependent on serendipity of scientists. They had to be planned within the given time frame. And so it became a teamwork. And there was a realization that better results are achieved if a team works on any particular project of discovery or invention. And that has been the case everywhere. Previously, there were stalwarts, individuals doing great work. Now, should we wait for stalwarts to come and take the next step ahead? Or all of us can come together and go on progressing on whatever path we have decided. I think in sports we have seen that they have become very professional now, and their teams are working for the success of the teams, or even individual athletes. The athlete's performance depends on so many people. In Ayurveda, one of the co-organizers is Ayurveda Vyaspit. Why did they feel the necessity of the Vyaspit? Because individual Vaidyas also can do little work. If they work as a group, they can advance more. Now here the College of Education and Jnana Prabodhini Kridakul. Jnana Prabodhini Kridakul is more interested in the practice. And they have to be forced to do some research. College of Education or universities, they are meant for research and training. They have come together to organize this conference. In the future, I think the Kridakul is the practitioner. The College of Education of Physical Education is doing the research work, and Ayurveda Vyaspit is actually doing the practice in medicine or applying Ayurveda to health issues. Those 3 organizations who have come together for the organization of this conference, I hope that they will continue working together and take big strides in this field of sports Ayurveda. New discoveries can be made in traditional subjects also. But following the modern practice of scientific thinking, just anecdotal records will not be sufficient for convincing non-believers. And science becomes universal when everyone has to accept the results because they are built on solid reasoning, logical reasoning. Prabodhini has been working in the field of Ayurveda for past several years. And we tried to start one new branch called Sukshma Ayurveda. We got excellent results, but we did not keep data at that time. There were just anecdotal records. This patient has sent a letter, this patient has sent a letter. If anyone asked, we just waved those letters, and no one were ready to believe these anecdotal records. So the Kridakul has advanced a lot after that time, and they have kept good data. Now the analysis of data and bringing out results which can be accepted by everyone, even by skeptics, is necessary to make advances in this field. And I hope that this conference and all the papers which were presented here will be a step in that direction. I give my best wishes for all the organizers and participants for making this conference a success, and invite all of you to keep on working together and thinking together and acting together. Thank you very much.
Thank you, Girisha. I definitely assure that we, all of us sitting in front of the, in the audience, would take this pioneering work which has been done by all these three institutes today, in these 2 days, will take ahead and do more research work as well as take Ayurveda in, over to the world in the field of sports. Now, just one announcement I have to make is feedback forms have been given to all. Mr. Anand Biraza sir is sitting behind. Just give your feedback forms to him before going. Okay. Let us declare that the conference has ended and end this session with prayer.
प्रार्थनेसाठी उभे राहूया. प्रार्थनेसाठी हात जोडावे. रत्नाकरा धौतपदा रत्नाकरा धौतपदा हिमालय किरीटिनीं ब्रह्मराजर्षि रत्नाढ्यां वन्दे भारत मातरं वन्दे भारत मातरं वन्दे भारत मातरम्. नमस्ते. 1 2 3 विश्रम. थँक यू.
अनाउन्समेंट करा.